how to become best Ayurvedic practitioner. All practitioners, all leading practitioners of young age, of senior age, will guide us, will inspire us that how to become, what should be the quality of best Ayurvedic physician. We have with us Adaraniya Rajan Patankar ji, Jayesh Thakkar ji, Shilpa Yerme ji will join us very soon. So we have a series of Piyush Dwivedi. We have a series of great practitioners here, right from Mumbai to Calcutta. Now, without wasting much time, I would like to communicate our sincere regards with happy birthday to Professor Madan Thangvelu sir. Sir, welcome, welcome, welcome. Thank you very much. आपको ये जीवन दीर्घायु हो, शतायु हो और निवेद श्रद्धा सतम वही वाली चीज हमारी पूरी एक ऐसी सुखायु और हितायु हो कि आप समाज के लिए बहुत कुछ कर सकें और हम लोगों को रोशनी दिखाते रहें। बहुत बहुत शुभकामनाएं आपको, हार्दिक बधाइयां। आपसे निवेदन करूं उसके पहले विष्णु प्रसाद शर्मा जी से आज के स्वागत के लिए फिर मॉडरेशन का दायित्व आदरणीय मदन सर का रहेगा। मदन सर बोल रहे थे अभी परमिट करिए, किसको, मैजा जी को जी?
हाँ जी, लगता मैजा जी लातविया से है, तो यूनिवर्सिटी की तरफ से कुछ है कनेक्शन इनका। विष्णु जी नमस्कार, प्रणाम।
नमस्कार, नमस्कार।
Very happy to be here with everybody.
So should I speak?
Maija ji is joined.
Thank you, thank you. You can.
Welcome, sir. Professor Vishnu Prasad Sharma ji, welcome. Swagatam.
Okay. Respected Dr. Madan Thangvelu ji, respected B.K. Agnihotri ji, respected Harish Barma ji, distinguished guests, eminent speaker, ladies and gentlemen. First of all, I want to offer wish you happy new Assamese year and happy Bihu to all of you. Today we have a wonderful webinar regarding how to become best Ayurvedic practitioner. It is most essential. We are waiting to hear from the eminent speaker regarding how we can become a best practitioner. Because knowledge is most essential to spread the knowledge of Ayurveda, not only all over the world. Today, we have an eminent speaker, Buddha Rajan B. Patnagar, Dr. Shilpa Patil, Dr. Pradhan Tripathi, Dr. Piyush Kumar Dwivedi. So I welcome all the distinguished guests, delegates, and speakers to this webinar. Thank you to all. Namaskar.
Thank you very much, sir. Thank you very much. Now I would like to welcome Professor Madan Thangvelu sir and want to request him to share the charge of moderation. Now stage is his. I am his follower.
Pavanji Pranam.
Pranam, sir.
Pranams to all our senior dignitaries here, our important minds who are giving us the energy and the enthusiasm for keeping this program going. Number one, a special thanks to Vishnu Prasad ji, special thanks to Agnihotri ji, and all who are gathered here today. Today is a very special day in the solar calendar. Today is Mesha Sankranti. It is Sankranti means the movement of the transference of something from one location to another. And today is the special day when the sun is moving into the constellation of ARES, Mesha Sankranti. It is also celebrated in different cultures in different ways. As Bishnu Prasad ji said, it is a New Year day for all the parts of India where they follow the solar calendar. Then it's a special day. It's a New Year's day. Many parts of India, Assam, in Kerala, they celebrate this special day. So it's the start also here of the transit from perhaps from spring into the early summer. So special day. When I look at the plants here today, all the leaves are coming out. It's the start of a birth of new life. And so it's an honor to be here with everybody on this very special day. The topic for today's 355th webinar is how to be a good Ayurvedic practitioner. KP Muralidharan is one of our senior Vaidyas and sometime principal of the AVP Ayurveda College in Coimbatore. And he has written a very interesting document, which is available on the web. Or let me also locate if I can put the link to that here. And the paper that he wrote is titled, The Vaidya's Mind. How does the Vaidya think? What is the Vaidya? Who is the Vaidya? And how does this Vaidya think? And what are the special aspects of the Vaidya's mind? And this is the question that we will try and touch today. We have many, many speakers here. We have a very senior colleague who's been also a source of strength for all of us, Vaidya Rajan Patankarji from Mumbai. And we will come across many more speakers as we go through the day, through the program. So without spending any more time, we look forward to listening from all our speakers on this wonderful theme about how to be a good practitioner, a good Vaidya. But now, before I transfer the floor back to Pavanji to introduce our speakers, I just want to add one thought here, that in Ayurveda, we have such a wide spectrum of knowledge about not only curing disease, but also preventing disease and maintaining health and promoting health. So that means you can be healthy one day, you can get better, be healthier the next day, or even though you are one day older, and so on. You can be healthy and you can maintain your health. And there are prescriptions for this in Ayurveda. And there are very strong prescriptions where it tells you how to prevent disease, particularly when we have transitions from one season to other. Ayurveda gives us descriptions of the Ritu Sandhi and what is to be done when you at this Sandhi period. And these are all things that are aspects of that Vaidya and how the Vaidya's mind works, and not only treating disease, but also promoting health and preventing disease and teaching people, empowering the patient, empowering the health seeker. This is a new word I've heard recently, health seeker. This is, people here are saying, don't call human beings patients anymore. They are lost. They need to be guided. They are seeking health. So how a Vaidya can influence a health seeker. And these are all the big lessons here in Ayurveda. If you look at the poster for this today's event, you will see my image there, of course. And I present myself here as a person from the sciences, from modern science, and how it interfaces with Ayurveda. But on my either side, on the left-hand side, you will see Bishnu Prasad ji, who's a very senior educationist and a very important practitioner. On the right-hand side, you will see Agnihotri ji, who is our senior colleague looking at Swastavrit and Sadvrit. This is a very important aspect. Okay. And finally, on the far right-hand side, we have Pavan Sharma ji, who is representing, over the last 3 decades, he has understood the Ayurveda industry in India. And the industry aspect is also very important in terms of producing formulations that can be used for people who are not well. So we, in a way, we represent that spectrum that is the bit I was talking about, going from health promotion, health maintenance, disease prevention, to cure using medicine. So I welcome all of you who have joined us today on this 355th webinar. Best wishes on this special day of Mesha Sankranti and the start of new growth, new ideas, new thoughts. Pavanji, namaskar.
शुभ नववर्ष सर। पश्चिम बंगाल की ओर से आप सभी को नए साल की शुभकामनाएं। आसाम को बिहू की शुभकामनाएं। पंजाब को हरीश वर्मा जी को लोहड़ी की शुभकामनाएं। कितना बड़ा एक सांस्कृतिक विरासत है हमारी कि वी आर सेलिब्रेटिंग द सेम इवेंट with different name and different culture, different system, different rituals. Everything is different. But the motto, the moral, the Vasudhaiva Kutumbakam really charitarth yahi hota hai. So without wasting much time, I would like to request Vaidya Rajan Patankar sir. He is great practitioner of nanomedicines, Sukshma Aushadhi. He is senior faculty of Sain Ayurvedic College. He is associated with various Ayurvedic organizations. Means whatever I can say, just it will be a lamp for a sun. So without wasting much time, I would like to welcome Patankar sir and would like to request Preeti from Med Pharma CRO to continue share the presentation. Dr. Patankar's presentation.
Rajanji, pranam.
Pranam. First of all, many happy returns of the day to Madanji, because
Thank you, Ji.
It's an very eventful day for me also, because yesterday when I talked with Pavanji, I thought this would be the right time to present this in front of all the Vaidyas, especially to boost the energy or the confidence of the junior Vaidyas who are going to be in the practice in the next some years or next some days. So this is a very excellent knowledge sharing platform. So pranam to my guru Dhanvantari, my grandfather, father. They were also doctor. My grandfather was first batch of MBBS in 1902. My father was Ayurvedic practitioner. He has passed out from R.A. Podar College, a very noticeable and very dignified college, government college from Mumbai. Then my Vaidya Prabhu sir, who has taught us excellent work, how to prepare medicines and how to use them. So that's why pranam to him also. And on the top of that, I had learned something from my side. It's something, but he has given me a lot of things and lot of allopathic practice. That is Dr. K. Ram Murthy sir. He was Padma Shri, so I should say Padma Shri Ram Murthy sir. And he was very enthusiastic about how the Ayurvedic medicines or how they work. So that's why, so pranam to all of them. And I will start my presentation. Madam, next slide, please. How to become a good or a perfect Ayurvedic practitioner. This topic was selected to boost the confidence in young Ayurvedic graduates. Many students came to me to learn Ayurveda. And if you are going to do Ayurvedic practice, then only come to me. I will be there for you always. As our acharyas also give us guidelines to practice, we must expand and extend our knowledge and explore new diseases, new medicines for the same. Because the guidelines were given, which were given in our original text, they are, in my opinion, they are guidelines. Because many of the plants or many of the manufacturing processes are very difficult nowadays. So in my practice or in our practice, we have to little bit modified them, but as per the rules of the Granthas, not to add anything from our mind, but we must explore, we must got the exact information about the plants, about the efficacy, about the results of the medicine on different diseases. Madam, next slide, please. So, to become a good or best Ayurvedic physician, these qualities are must in each of the Vaidyas. I should say, I don't even say myself as a doctor, but a Vaidya, because this is the thing which was given by Dhanvantari, and it's a order by Dhanvantari to serve the needy people and to serve the society. So a physician must be a good listener. Why? Because patients are coming to us nowadays with their n number of problems. But when they go to any another pathy, they even don't listen to their problems or their conditions, just prescribe medicines, and that's all. The rapport between the patient and doctor is only for few minutes or few seconds also, only to prescribe medicine. Don't take his proper history. So that's not correct, in my opinion. He must be a good listener. He must have a good and presentable face also, because as we say in darshan pariksha for patient also, the patient also see the confidence in that Vaidya also. So that's why his face should be good and presentable face. He must be always happy and always smiling, because the confidence in the Vaidya itself boosts the confidence in the patient also. So he must be having a sattva guna, that is, he must be calm, quiet, and very well knowledge enriched. So that's why he can deliver the problems, deliver the solutions to the patient in a proper way. He must be a good counselor first, because nowadays in this pandemic also, or previously also, so many patients are suffering from stress diseases, like many of the patients in this corona pandemic, stress related hypertension, stress related blood sugar, and stress related abdominal pains, or having IBS also. I've seen so many patients. So he must be a good counselor to सबके जो प्रॉब्लम्स है वो सुन करके उसको सॉल्यूशन बताना. तो इसके लिए ही मस्ट बी ए गुड काउंसलर, एंड काउंसलिंग में उसको जो भी है उसमें जो भी हमारी चिकित्साएं है, व्हाट द चिकित्सा और व्हाट द प्रिस्क्रिप्शन ही इज सपोज टू गिव, he must give it properly. So before giving the medicines, the counseling is a must part. He must be a good friend and guide on all fronts along with medicines. He must be a good family physician, I should say. So because the concept of family physician nowadays is not there, because patient is having no patience, and doctors also. So that's why we must be a good friend and good guide to all the patients who are coming to us, and we must follow these things to encourage or to give knowledge to common people also. Knowledge about sites and Google, newspapers, and YouTube is nowadays very dangerous. I should say that Google Baba is most dangerous nowadays, because so many things were blindly followed by so many patients, and they are in so many problems. So while coming to us, while coming to me or to us, we must ask them these questions also. Have you read or have you seen any Google Tube or on YouTube or on newspaper and following these misconceptions? Because they are confidently lying all the things and confidently telling or confidently presenting all the improper things on these things. So that's why we must be aware of that also. If required, we should go with minimum examinations, that is X-ray, sonography, when it is needed, because we must know the strength and the weakness of our science also and of other science also. So that's why when and if it is needed, if a patient has got meet with an accident, he should be followed by X-ray or sonography, or he must need at that time any proper treatment of allopathy or inipathy. So that's why minimum examinations, because nowadays when a patient goes to any doctor, he will write down so many things. I shouldn't say it's now it's not a proper word, but nowadays it's a cut practice, and it has been performed in so many areas, not in Bombay, but in all the big cities, or nowadays in remote places also. So, madam, next slide, please. As per the Ayurvedic examinations, as I say, he must be a good counselor. What we have to do basic examinations by the doctor should be followed, because the patient, if we see as a patient in front of us, that is the darshan pariksha, sparshan pariksha, and prashna pariksha. This is the basic of Ayurveda, and this must be learned by each and every doctor who is upcoming doctor, or who has been practicing as a Vaidya, not as a doctor, because we can find out so many diseases or so many problems or so many purva rupa, that what he has done in previous, then what is his condition now. So that's why darshan, sparshan, and prashna, this pariksha should be कंसिडर्ड मोर इम्पोर्टेंटली कि उसका जो अभ्यास है वो भी एकदम अच्छी तरह से जब हम पढ़ रहे हैं, when we study, that should be studied properly, because this is the basic of Ayurveda. And to become a good practitioner, yes, it's a must and it's a need of the hour. So we must explain him about the ahar, nidra, and brahmacharya, yoga, vyayam. Ahar, most important part, because in my practice, I first of all write down the pathya and then medicines. And I told my patients that pathya is more important than medicines, because the pathya part you have to follow lifetime, but not medicines. Then nidra, yes, proper nidra is also important. So patients say, yes, I sleep for 7 hours. Some says I sleep for 6 hours. As per the prakriti and as per the age, nidra will be varied. So importance of nidra should be explained to the each and every person very properly. Brahmacharya means to follow the rules and the regulations of Ayurveda. Not only brahmacharya means not to marry or to stay away from the society. No. So that's why brahmacharya should be followed like this. Then yoga. Yoga is nowadays called as yoga. So the rituals which have to be done daily or should be practiced daily is called yoga. Yoga means niyama, and that is to be followed every day. Because not only yoga day, because so many patients or so many persons are following all the asanas or all the yoga on only yoga day, and then after they forgot all those things. Vyayam, importance of vyayam also is also most important and should be taught or should be administered properly to each and every patient, because the importance of vyayam as per Ayurveda is to make a healthy mind and body, not only body. So for that, vyayam as per Ayurveda must be done ardha shakti. When you get fatigued your body and mind, you should stop there. The bodybuilders and all those competitors who are performing their performances in Olympics or in other sports, yes, for them this vyayam is important, but for a common man, Vyayam should be Ardha Shakti. The importance and the exact and proper knowledge of dosha dhatu mala is also important for Vaidya to be a good practitioner, because by examining these things, he can be very precise while prescribing medicines. Importance of dosha dhatu and mala, which should be interrelated and should be explained to each and every patient, because in my practice, yes, I do follow this. I explain my every patient or every client, I should say, what is the problem in your body and how we are going to modify it, and how much time it will take. Because by saying or by telling to our clients or patients, it gives more better and better effects for our medicines also. Because as I previously said, he must be a good counselor, he must be a good listener. And to explain all these things, it will definitely benefit the patient. Then there are the chikitsas, which we are following as per Ayurveda. Yukti Vyapashray, Sattva-vajay, Daiva Vyapashray, and Ashvasan. Nowadays, Ashvasan comes under, I think so, counseling is the most important examination or the most important chikitsa in nowadays life. Because only by giving medicines, it won't work. So counseling and Ashvasan. But don't give a wrong Ashvasan or wrong sympathy to patient, because he may land in complications also. To gain success and to be a good practitioner, you must study all the proper knowledge and all the proper things while when you are studying Ayurveda and after Ayurveda also. You must be continuously in medical education lifelong. That is what my opinion. Madam, next slide, please. To boost up the confidence of the practitioner, I won't go in details. As I said, ki Chaturbhujaras or hyperacidity, then herpes simplex, that is Visarp or Nagin, jaundice, Halimaka, hepatitis, global ischemia, pregnancy problems, urinary stones, and varicose veins. I will explain you one or two examples from this. Pregnancy problems nowadays are very common in big cities because there are n number of factors. Ego problem is there, late marriage is also there, and improper diet. So in last 2 to 3 years, I came across 8 such patients, infertility patients, and by only giving counseling or only giving proper pathya, the woman conceived in 3 to 4 months of time. And by giving some simple medicines to release their stress, means for both of them, for male and female. So I use in my practice Smriti Sagar Ras, and because it's a very good stress release medicine, what I have studied, and literally it gives excellent results. But importance of pathya is also important. So I came across all these 3 to 4 patients which I had done in the last 2 years. Administrating or eating English or broiler chicken with eggs is the most dangerous factor nowadays, because to boost their life and to boost their weight, the medicines or the injections which they were given contain steroids, and in my opinion that is the major factor for infertility. So that is my observation, and I came across so many patients of this type. Then global ischemia. Global ischemia is a very, very rare disease, because in my 34 years of practice, I had seen only one patient of global ischemia, and he was he came to me as a stamped global ischemia patient from one of the good hospital in Mumbai. So I treat as per Ayurveda as a shusha, and so I had given him medicines as per his prakriti and as per his conditions. And in the last, he was given Sukshma Aushadhi to revise all these problems. And he has gained his weight also and his confidence also. He was a painter by profession. But a very sad thing, after getting good results, that person has done suicide and now is no more. So I couldn't present him in front of you, or if it, I would like to present him in front of you. Then all these diseases should be and must be given proper advice of Patya in all these conditions. And by using nanomedicines or Sukshma Aushadhi, all these conditions, we get more better results. So this is only to boost up the confidence of all the practitioners and to boost the confidence of upcoming or new Vaidyas also. Madam, next slide, please. Madam, next slide. In this COVID, as I said, I treated asymptomatic patients with Guduchi, Sukshma Abrak, and Swasputar Ras in powder form, and the patient get good results. And Guduchi is my, I should say, a beautiful and a patent drug to boost up immunity. So I myself is taking Guduchi for last 3 years, means from before pandemic also, only 2 tablets after breakfast, and that is more than enough for everybody. So learn to manufacture nanomedicines from my Vaidya Prabhu sir, and practicing and distributing it for last 15 years now. This was a slide, or this was a presentation made last year. So for 15 years. And I had given so many lectures on preparation of Sukshma Aushadhi, the benefits of the Sukshma Aushadhi on so many platforms. But still, very few people are manufacturing it and using it. Users are more, but manufacturers are still less. In my practice, there are a number of opportunities in our new practitioners, like different subjects of cosmetology, panchakarma, marma chikitsa, dietetics, and then he can be a good lecturer and good manufacturer also. Madam, next slide, please. In my practice, most of the time I use Shamana Chikitsa, because Shaman Chikitsa is also having good results. We can give quick results also by Shaman Chikitsa. And as per Panchakarma, I had conducted 8 series of Panchakarma Karyashala in our college to boost up the confidence of the Vaidyas, not for the students, only for the Vaidyas. And they are doing excellent work. So in form of Panchakarma, I use only Matra Basti and Vidya-karma. And Vidya-karma, as per our late Vaidyaraj Bokte sir has advised me, is by insulin needle and not by Vidya-karma by in any other form. Most of the cases done by Saman Chikitsa gives excellent results with Shodhan done only in a form of Matravasti or Vidya-karma. Being a family physician, I recommend to take proper history of a person and to give him proper advice. And I told my patients, come to me after recovery only to meet me, and we will have a cup of tea, but no need to take medicines. And so that's why family physician is need of the hour. And as per the guidance or the motto we should follow to become a good practitioner. So that was my presentation. Thank you very much, Pavanji, for giving me this opportunity to present some of my views in front of all of you. And I'm waiting, eagerly waiting to hear other participants or other dignitaries also. Thank you. Thank you, everyone.
Thank you, sir. Thank you very much. You are the inspiration, sir. You are the inspiration. Madan, sir, please. Dr. Madan Thangvelu, sir. Your valuable comments. Madan, sir, is muted. You are muted, sir. I hope he is busy with Agnihotriji, pranam.
Pavanji, pranam. Sorry, I was.
Ji. Stage is yours.
Rajanji, thank you so much.
नमस्कार हमने कहा हम ट्रेन में इस समय
वाह बहुत अच्छा
मॉर्निंग का पहुंचे यहाँ तक लेके सभी
Agnihotriji,
लोग ट्रेन में हैं
Namaskar ji.
नमस्कार sir.
Rajanji, thank you so much.
मदन सर जी आपको बर्थडे की बहुत बहुत ग्रीटिंग्स
Hari Om. Namaskar ji. Thank you so much.
नमस्कार जी
Thank you ji. Very happy that you could join us. Aap Lucknow mein hai, but very happy that you could join us today. Very, very happy. Thank you for joining us. Rajanji, thank you so much for sharing so many examples. You have shared earlier that the case of global ischemia, it's a very, very important case, and your treatment and treatment responses. From your many decades of practice, we have a lot to learn. And the first important point that you touched on, which is that today, doctors don't have time to listen to the patients. And this is a big samasya, this is a big issue. And many problems are not understood. There is a saying here that most times doctors are treating the medical report and not the patient. And so we are saying, understand the patient. Don't treat the report, which is the disease, treat the patient. So we thank you for sharing. I know what you have presented today is only a very small part of your experience and what you have. And this is why it is so important that you are here with us today and you are sharing this. Many of people who will be listening to this program will come to you wanting to discuss and learn a little more, not only about the interaction with the patient, but also to understand some of those special formulations that you make, the sukshma formulations and some variations that you have evolved over the years. So we are very grateful. We look forward to coming back to this point about both those issues, how you manage patients and your experience, and also aspects of innovations for the future in terms of formulation. So from all of us, thank you so much for gracing today's events, and floor is back to Pavanji. Pavanji, namaskar.
Thank you, sir. Thank you, Rajan sir. Thank you, Madan sir. दोनों को बहुत बहुत हार्दिक आभार. आज की वेबिनार जो भी है दायित्व वो राजन पटनकर जी के आदेश से हो रही है. अदरवाइज आज के लिए मुझे कोई स्पीकर नहीं मिला था. आज इंटरनेशनल ह्यूमन स्पेस डे है, तो I was searching for some space scientist who can guide us that what herbal medicine are being used in space also. So that was not possible. So now I would like to request, just now, sir, for Hemophilia Day, please guide me. Who can guide me from all over the world for herbal treatment or AYUSH treatment of hemophilia or moreover thalassemia? I don't know. Harish Verma ji would like to say something. Harish ji, well,
जी सर, प्रणाम सभी आचार्यों को प्रणाम।
Ram sir.
राजन जी की प्रेजेंटेशन बड़ी अच्छी, बहुत प्रैक्टिकल। राजन जी, एक छोटा सा सवाल, उससे डिस्कशन शुरू करेंगे बाद में। वैद्य और डॉक्टर में क्या डिफरेंस होता है, ये थोड़ा सा बताइए आप, कि एक वैद्य और एक डॉक्टर दोनों हिस्ट्री लेते हैं, थोड़ा सा बताइए इसके बारे में।
हाँ, जरूर जरूर जरूर। वैद्य, जैसा मैंने कहा कि he must be his face or his body language, and the body language of nowadays the doctors which I had came across, so many doctors, the interaction between the patient and the doctor or the person who is sitting in front of him in a big chair, उसमें जो दूरियां है वो वैद्यों के पास नहीं होती है, या वो जो वर्ड है जो वैद्य, उसमें वो सब समा गई है। और डॉक्टर्स के पास, जैसा मैंने कहा कि उनके पास आजकल समय भी नहीं है सिटी हॉल लिखना, इसके ऊपर वो ज़्यादा कुछ सोचते नहीं है। तो ये ऐसा एक मेरा कहना है, और मेरा जो एक मैंने यहाँ पे जो देखा है, स्पेशली बिग सिटीज लाइक बॉम्बे, सो दे आर नॉट इवन इंटरेक्टिंग विद देम। एंड मैं आजकल के इसमें जो एक टेलीमेडिसिन वगैरह ये सब चीज़ें अच्छी है, पर बाय सीइंग अ पेशेंट or by without seeing a patient, or seeing a patient on your WhatsApp or WhatsApp video call is not correct in my way, because I used to practice throughout the corona pandemic, practice for less time, कम समय प्रैक्टिस करता था, पर प्रैक्टिस मेरा जरूर शुरू था। और यही एक वैद्य की खासियत है कि टू नो द पेशेंट वेरी वेल, और उसके बाद में उसकी चिकित्सा। तो ऐसा एक मेरा कहना है। हरीश जी, आप भी उसके बारे में और गाइड कर सकते हो।
नहीं, इसके बारे में बाद में डिस्कशन करते हैं। बेसिकली मुझे ऐसा लगता है कि जो वैद्य हैं, जो आयुर्वेद में हम लोग बॉडी, माइंड एंड सोल, हम तीनों को कंसिडर करते हैं। बॉडी, माइंड एंड सोल, तो शरीर, मन और आत्मा। जबकि एलोपैथिक साइंस में, जो एलोपैथिक साइंस है, ये सिर्फ बॉडी और माइंड तक लिमिटेड है, सोल का कॉन्सेप्ट ही नहीं है। तो जब तक आप आत्मा को टच नहीं करेंगे, वो प्रॉपर हीलिंग हो ही नहीं पाएगी, ऐसा मेरा मानना है। इस पे और डिस्कशन करेंगे, और कुछ चरक संहिता के रेफरेंस भी निकालते हैं इसमें से। थैंक यू सर, थैंक यू।
Okay, thank you.
Thank you, Harish ji, for raising a very, very important point of the three aspects: body, mind, and the soul. This is the aprathyaksh jo hum kehte hain. Thank you. We will come back to this very important point in our discussion. And as we move through, Pawanji will introduce our next.
Thank you, sir. Thank you very much.
Thank you.
Now I would like to request young, dynamic, energetic Ved Jayesh Thakkar. Welcome, Jayesh. He here in West Bengal. He is the real resource person, sir. I don't know, numerous courses he has attended. He is the best resource person in West Bengal. He is founder of Jai Ayurveda, successfully maintaining it from last so many years. And now a branch is also opened for Jai Ayurveda. Dr. Jayesh, welcome, Jayesh.
Om.
Namaskar.
Namaste, namaskar. Thank you. On account of Ambedkar Jayanti, Mahavir Swami Jayanti, first of all, Ambedkar ji's birthday, and today a very special day, New Year for the Bengalis, Baisakhi, and a lot of celebration. I also take the pleasure to wish Professor Madan Thangvelu sir a very happy birthday, and I thank IRES team, the organizers, Dr. Pawan Sharma sir, Dr. Vishnu Prasad sir, and Dr. Professor Agnihotri sir. So without, and all the delegates present, my speaker, first speaker of the day, Rajan Patankar sir, and all the speakers who are without taking much time, let me share my screen first. So it's a very important topic. Is my screen visible?
Yes. Yes.
Yes.
Visible.
Thank you, Jayeshi. We can see it very clearly. Thank you.
It's full screen also.
Full screen now. Thank
Yeah.
you. It's just coming through.
So with your due permission, let me start for today. Just few minutes and few simple points. So the topic, let me take it differently. Thoda alag se. I keep it as an aim. As an aim, why? Because I agree, I'm not the best, but I have to be the best. Today, there were a lot of options to be invited as a speaker. But in the yesterday itself, when Dr. Pawan sir called me up, and as a member of the organizing team also, it happens. Okay, when there is no player, then the extra player have to take a lead role. So as an extra player, I have come
You
here.
are not extra player, dear. You are the main player.
Thank you, sir. It's your greatness. But myself just is keeping an aim, a target. The first line comes as to become best practitioner. Here, not a physician, practitioner. Practitioner is something who practices. And the practice is not something with patient, it's with practice with self. If I say Dinacharya, Brahma Muhurat, yoga, then I have to practice. So I think I'll try to discuss the whole thing in a different way and a different analysis actually. It's not a physician, it's a practitioner, one who has to practice. What? It's Ayurveda. And what is Ayurveda? Ayu, the way of living. Myself, Vaidya, Dr. Jayesh Thakkar. Doctor is a degree. The ministry or our board, the medical board, permits to BMS as well with other streams of doctors. I add in Vaidya before my name because as just we had a discussion, Vaidya is also someone who is going to treat beyond the body. The mind and soul has definite role in treating a patient, a person. Because when a patient comes, it's not we are treating the body, it's something beyond that we are treating. And Vaidya, the meaning which always strikes me is Vedna. Someone who understands the Vedna, the grief, the sorrow, the pain of a patient and tries to heal it is a Vaidya. And if we can, then we can be the best. This is my simple analysis. In Ayurveda, as you see in the top line, there is a sloka in the first itself. I'll be trying to compare with sloka and reality also in my analysis. Ayurveda Updesa Paramadara. Can you remember? It's in the first chapter of Ashtanga Hridaya. Ayu Kamya Manina Dharma Artha Sukh Sadhanam. Ayurveda Updesesu Vidaya Param Adara. So to be the best, first of all, we have to believe, we have to follow the Ayurveda Updes. I'll be speaking as if I'm also sharing the knowledge and everything what I have learned from my seniors, from so many webinars, and also to inspire my next generation, my friends, and my colleagues. I'm a BMS, Bachelor of Ayurvedic Medicine and Surgery, that is called Ayurvedacharya. Yes, just a BMS can also be the best. That's my theme. I do courses to upgrade myself, but I stick to the principal BMS only. My clinic is Jai Ayurved. I kept the name Ayurved because I need to always remind myself that I have to be best in my stream. And everything what I'll be discussing only 5 points, not many points. सिर्फ 5 ही point कहने में आया हूँ. और ये जो भी मैं डिस्कस करूंगा, ये जोत से जोत जलाने की ये बात है. मैंने जो भी सीखा है, एक दिए से दूसरा दिया जलता है, और मैं भी चाहता हूं कि जो अच्छी बातें, छोटी बातें आज मैं आपसे कहने जा रहा हूं, उससे और भी बेस्ट प्रैक्टिशनर्स तैयार हो. So the first point, follow the best. This is my analysis from my clinical practice of last 8 years and observing so many senior practitioners, being participant and listener to so many Vaidyas. So first thing is we have to follow. This is looking outward. So किसको follow करना है? सबसे पहले आचार्य. Our acharyas, the one Charak, Sushrut, Vagbhat, Maharishi Vagbhat. I'm not going to, because everybody knows about them, I'll just add something, just for a moment. Think, what does the Charak, Sushrut, Vagbhata means? Charak, someone who is traveling. Sushrut, someone who is skilled with his hand, with surgery and with doing so many therapies. Vagbhat, someone who can speak well, who can share his knowledge, experience to others. So this is the very brief I want to take. I am not a very big scientific personality. I am a ground worker. I work as a practitioner. So from the ground level, I will say, the Charak Sushrut Vagbhat means to me, you have to travel, you have to reach to the patient. Sushrut, you have to be skilled with your practice, your hand and therapist. Vagbhat, you have to connect with your patient. Next, whom to follow? Our gurus, the one who are the masters, the one who are good practitioners. We look around, the one who are practicing well, what they have practiced, what they have not. And what should be the science behind, or what should be the theme to be best? Dharma, Artha, Kama. Dharma is doing your duty. It's something beyond religion. Artha requires the objects we require for starting a practice, for doing a good practice. You need a clinic, you need a setup, you have to develop it. Kama is desire. As our desire here is to be our best. We are not going to compete with anyone. We are going to self-compete, improve ourselves. Yes, we have to look to the others. Who are the others? Our colleagues. We have to look to our friends, our seniors, those who are practicing well, those who are doing best in their field. We have to look at other professionals also, the engineers, how they balance, the IT peoples, how they balance between their work and the job. We have to look at them. The CAs and all this. And here the line of the Sushrut Samhita, which strikes me, the Shastra and Ekam Shastra, we have to go beyond our Shastra. Learning Ayurveda, we have to know about the other Shastras also, be it the Jyotisha or be it something with biotechnology. We have to know about it. Then only following the best, looking outward, we can. Moving to the second point, it's practicing the best, looking inward. We have to practice. Ours is a science. But when we say Ayurveda, it's Vigyan. We say it's a Jnana, we say it is Shastra. But looking at it as a science, looking at the practice as science and arts, first of all, let's look at science. It's update and learning. We need to update ourselves regularly. There are lots of things. There are short courses going on. We need to update. And recently there was a point. If you are not updating yourself, you are not moving ahead. You are staying where you are. You have to make yourself skilled. As we are Sarir, Man and Atma, this development should come at everywhere. Just learning or being knowledgeful will not help. We have to balance. We have to uphold our meditation. Like the Nadi Pariksha. If I say I am not expert in Nadi Pariksha, I have to learn this. It requires very minute observation, meditation. There is tongue diagnosis. Going beyond the Nadi Pariksha, there are Astavidha Pariksha. Why are we not thinking about it? We have to think at every level, because today best is not necessary tomorrow best. So we have to continue. It's an art. It's connecting with our patient. हमें अपने patient के दिल में जाना है. There is a slok also. Not going to the slok. Unless and until we understand the patient's Vedana, we are not able. This is a part of art. So just mugging up some sloks or books is not going to make us a good practitioner. We have to know the connection, connecting with the patient's soul, his mind. We have to understand what he wants to say. If a patient comes to me, and suppose a piles patient comes to me and I try explaining everything about the whole chapter, he's not interested to know about it. Provided if the patient waiting chair is not comfortable, the piles patient will not be comfortable. So I have to think beyond the level what I am thinking. The presentation, how we present ourselves, how we express ourselves, how we understand them. So here comes, these are just brief. I want the best practitioners to connect the dots. And I know the best are understanding what I want to say. There are many things which are beyond words. The 4 yogas, Karma Yoga, Dhyan Yoga, Jnana Yoga, Bhakti Yoga, we need to develop it. If my Jnana Yoga is less, I need to develop more and more knowledge. If my devotion to Ayurveda is less, I also need to develop the Bhakti Yoga. And if I balance, if I grow all this yoga, the art, the science and art, my inward practicing the best comes. Coming to the next point, to me, it's giving your best, looking at self, all-rounder. जब हम बच्चे थे, we used to learn jack of all trades, master of none. But the time has changed. We have to be master of all. Now in cricket team also, we look at all-rounder. Earlier, they used to look at fast bowler, spinner, wicket keeper separately. But now, if you are all-rounder, then only you get selected in cricket team. So we have to know the skills, and it's self-hero. We have to make ourselves hero. And here comes my tagline or tip. It's Brahma, Vishnu, Mahesh. To me, it's generator, operator, and distractor. You should know which part or which thing you need to generate, which skill of yours you need to develop as an all-rounder. You should understand which skills you are not good and you need to develop to be the best. Yeah, there is a point optimum. जैसे हम स्वर्ण प्राशन कहते हैं कि स्वर्ण प्राशन से बल, मेधा, the memory and everything increases. But will the memory of every child increase? Will everybody get A+ memory? No. When we say this, we mean it will be to the optimum, the best possible for that child. So similarly, we have to reach to our best possible. I have a memory. I know the limitation of my memory. I cannot say that I can learn the whole slokas and everything. So I have to know my limit and I have to be at its optimum best. Sometimes we have to choose the middle path because I know the skill of my hand and I know how much minor stitches I can do. So I know the limitation, and it's not that we have to give our best, but that doesn't mean that in everything and everywhere we can give our best. And here the tagline, the sloka which strikes me in Astanga Hridaya, when Vagbhata tried to include the earlier Shastra, Charak Samhita, Susut Samhitas, a point he mentions, na sangsipta, na vistaram. So it's something like that. We need to bring a middle path. So the 4th point, take your best, balance it. Socially also being a balance. As a good physician, we need to balance. We need to balance. Yes, we have to balance our family time. As a practitioner, we have to balance giving time to our patients. If another patient is waiting and to one of my patients, I give my whole time, it's also not possible. So socially making a balance is very important. We have to take out time for our body. If we ourselves become ill or we are ourselves not taking sleep properly, then how can we say that ahar, nidra and all this you need to follow? Just coming practitioner, practicing our science will bring the best out. And here I look at what we need socially is Ganesh, Lakshmi, Saraswati. Ganesha, because I'll take it very simply. If you think it's your presence, it will be Ganesha, reputation, your establishment. Lakshmi is something money also we need knowledge also to be the best and to develop. And keeping a target there, so these targets are taglines. Coming to self, it's SWOT analysis, our strength, our weakness, the opportunity and the threat. We have to analyze it. And I myself have to come out of the comfort zone to achieve the aim, to achieve my aim to be the best. Our sloka, Samadosa, the swastha, swa avastha. So being the balance, bringing the balance is important. And when I say it's bringing the balance, so we have to bring the balance with ourselves. And the only one point as a carry message I would like to say is just one thing, one best you have to do. सिर्फ एक ही चीज करना है, ज्यादा कुछ नहीं करना है, एक ही improvement करना है daily. I keep a target, daily reading one medicine from the Shastra, one dravya, one plant, doing one something new, one social post, one inspiring thing, one Shastra reading, one Sloka reading, just one. And when you, with this one, the changes comes. It's Adhyan, Adhyapan and Sambhasa, what our Acharya says. And this extra doing is something which is in fact going to help us. One is very small, but at the end when you look, together, boon boon se sagar ban jata hai, and that's how the best comes up. Change. Yes, little change we need. We need to connect with our old friends. We need to connect with our old patients, those who have discontinued. Why they discontinued? An analysis requires. We need to connect new. We need to connect new. Nowadays, it's social media is there. We need to connect to a new person, new teacher, new course, something to update ourselves, just one, and the best comes. And here I would like to mention my spiritual guru, Adhyatam Guru. He said, "Hum sudrenge, yug sudrega, hum badlenge, yug badlega." I take only this tag message. I have to improve. I have to refine myself. Then only I can change myself into the best. So it's a together we can make the difference. I'm not the best, but together we will be the best. Yes, we will be. And it's like the Satyam Shivam Sundaram, the tagline. Now you try to connect and bring out the best. And yes, not forgetting is the Chikitsa Chatuspad, the gunas of Chikitsak, which is mentioned by Acharya. That only brings the best, makes the best. So if I keep an aim, focus, it's like follow, practice, give, take one. This were the 5 points I have discussed today. Following the best, practicing the best, giving the best, taking the best, and doing one best. And if I keep an aim that I want to make a multi-speciality Ayurveda hospital with best physicians, I need to perform. I need to take fees, service charges. There is no wrong in taking that, but it should be in a balanced way. The money, blessings, experience, Ganesh Lakshmi Saraswati connection, and let's be the best. I thanks the whole team to invite me today to share my choti choti batein. Thank you, sir. Thank you all. And let's take the best to the infinite. Jai Ayurveda.
JSG, thank you very much. You are saying choti choti baat, but these choti choti baat are the moti moti baat. So I just want to say you have shared with us some very, very, in a very special way, you have shared with us your wishes, what is in your mind, how you want to take, how you see incremental improvement as the answer, and how you have to hold it dear to yourself. Before we return the floor back to Pavanji to introduce our next speaker, I have a question which is on the mind of many of the people here listening here on the platform and also on YouTube. You have just started your second clinic. Please tell us, before you go off the platform, please tell us a little more. We will come back to this in the discussion too. Just a little bit of where the second clinic is and the strength, how you're going to, what you have in mind. Thank you.
Sir, it was an analysis only. The whole presentation today I have been working in my mind only. And as an extra player today when I entered, the whole thing, how to develop my practice. After my BMS, I decided I have to practice. Due to that particular reason, I didn't go for higher studies. I know a selected percentage or good brains only, or those who have a good memory, I would rather say, because nowadays studies is something which is more than all-rounder. Anyway, so I thought that who will be an inspiration for my BMS friends? So let me practice my best, and together we come out and together we grow. Yeah, I do short courses to upgrade myself. I do other stream courses also. But here what I mean to say to the question particularly which you asked, that it was almost 7 years back, I started my practice in Kolkata. You know, as we practice, we grow and the things, ideas come. that time when I started practice, many people, many colleagues and many friends, those who have their clinics, requested me to come and practice their place only. I said, no, I'll practice just at one place. It's in Kolkata city, South Kolkata. I said, I'll sit only at one place only, no other. And you can see behind me, there is a wall. So I used to say that in my chair where I sit in the clinic, this is the only place I have. I have nowhere else to run away. The board before me also is Ayurveda. So making this practice was that I have to practice pure Ayurveda only. And I have no other way to grow. And I learned that like a sun, you have to shine. From one place you have to grow. People who wants to connect me, they will come to me. Yeah, socially I got connected. I have many foreign clients also. Every week I consult 1 or 2 foreign clients. That's through different platforms. But the practice grew that way, that is by mouth publicity. It's not the advertise when we practice. In the 7 years, the result what you saw. And every day you have to do something new. You have to stay where you are. Because if you can't move, you cannot go further. Then I learned during the COVID times, I need to connect with my rural people also. I opened my branch. It's 150 kilometers from Kolkata. It's Bengal and Odisha border. It's my hometown. My earlier schoolings was done there. So I thought that let me connect with the rural people also. And that way, it's how we started expansion. So it's on Sunday, and occasionally by connecting online, I need my service. And here also the tagline, the Charaka, to move to different places. Of course, I need a lot to do with the Susut, making myself more skilled, Vagbhata, and so many stages we all need to pass. That's the only thing I would like to say just.
Jayji, thank you so much. Many people don't appreciate you are the heart of our organization. You are the strength of our organization. You work very silently behind. You connect a lot of people. You bring so many people together. So we're very grateful. On this special day, we're very, very grateful for your help, your strength, your inspiration. And now what you're doing will be a strong message to many people around India, around the world, the youngsters. And we will come back to you and trouble you in the future. There'll be many, many young people who will want to come, want to understand West Bengal, want to understand Orissa, want to understand the rural situations. Please, I hope you will stay with us through the rest of the program.
Yes,
because
yes. So there are many
best
are with us, and there are many best. Sometimes it requires just a polishing, and so many diamonds will be coming out, and together we can do much for our Ayurveda.
Thank you so much. Thank you. Thank you for your wonderful presentation. It is a reference presentation that we can revisit and study from. You have raised many, many points there. Thank you. I return the floor to Pavanji. Pavanji, namaskar.
Thank you, Dr. Jayesh. Thank you very much. You have excellently expressed your deep sentiments, which are necessary for everyone. Absolutely necessary for everyone. And I hope Harish Vermaji has also received the answer what is difference between doctor and Vaidya, because doctor can't think so much, and Vaidya Jayesh Thakkar, even though doctor is there, then also he is thinking. That is the creativity of a Vaidya only. That doctor can't think. Doctor will talk on only topics, but not on patient. And as we consider patient as wholesome, so we are really appreciating your sentiments. Now, I would like to request Dr. Piyush Kumar Dwivedi, MD Kaya Chikitsa. He is reader in Ayurvedic College and honorary physician of Governor of West Bengal, Hind Motor Ratna, Shankaracharya Vishisht Chikitsak Samman, honored by Calcutta Acupressure Mahila Samiti and Vishuddhanand Mahila Samiti. Welcome, Dr. Piyush Dwivedi. Kindly unmute yourself. Stage is yours. Welcome. Dr. Piyush Dwivedi ji, kindly अपने आप को unmute करें. मेरी आवाज आप तक जा रही है? पीयूष द्विवेदी जी, मैं चेष्टा कर रहा हूं उन्हें इनवाइट करने की।
Thank you, Swami. He's हमारे साथ तो है मगर म्यूट अनम्यूट नहीं।
काइंडली अनम्यूट पीयूष द्विवेदी जी। नेटवर्क कवरेज से बाहर बता रहे हैं सर।
अच्छा जी।
तब तक मैं आपकी आज्ञा से अभी दो शिल्पा जी जुड़ने वाली हैं।
अच्छा
मैं विष्णु प्रिया जी से संक्षिप्त उनके विचार यदि आप परमिट करें।
बिल्कुल जी, बिल्कुल, प्लीज। विष्णु जी है हमारे साथ। विष्णु प्रिया जी, नमस्कार जी।
डॉक्टर हरीश वर्मा जी बड़ा अच्छा आर्टिकल शेयर किए हैं।
हाँ जी, वेरी नाइस वन। क्वालिटीज ऑफ द फिजिशियन मेंशन बाय
जी जी।
आई थिंक
आई एम ट्राइंग, यू कैन कंटिन्यू द डिस्कशन सर। इन द मीन टाइम आई एम ट्राइंग।
while we wait for Vishnu Priya ji, and the floor is open for discussions for the till we wait. Thank you, Harish ji, for sharing this wonderful article and the link to this article. We await while we wait for Piyush ji and Vishnu Priya ji. I can see Renu ji, namaskar. Shailaja ji, namaskar. शिल्पा जी आ गया फोन जी। शिल्पा जी नमस्कार।
नमस्कार सभी को।
शिल्पा जी नमस्कार। You have come at the right time. शायद पवन जी will request. रेणु जी नमस्कार। While we wait for शिल्पा जी।
डॉक्टर मदन जी, एक सवाल डॉक्टर राजन जी से है।
हाँ जी, प्लीज।
तो डॉक्टर राजन जी, जो आप डायग्नोसिस करते हैं वो आयुर्वेदा के ऊपर बेस्ड होता है या मॉडर्न मेडिसिन के ऊपर बेस्ड होता है?
नहीं, आयुर्वेदा के ऊपर ही टोटली। हाँ, पर पेशेंट जब भी बड़ी फाइल लेके आता है तो उसको भी फॉलो करता हूँ, क्योंकि हमें आयुर्वेद में भी या कोई भी शास्त्र कम है ऐसा नहीं सोचना चाहिए। तो उसका सहारा लेकर के हम और भी अच्छी ट्रीटमेंट कर सकते हैं, ये ऐसा मेरा मानना है। तो सभी शास्त्रों का अभ्यास रहना ये ज्यादा जरूरी है। पर अगर आजकल के मॉडर्न डायग्नोस्टिक मेथड्स है तो उसको देख करके पर जो निदान किया जाता है वो आयुर्वेद के हिसाब से ही किया जाता है और ट्रीटमेंट भी वैसे ही की जाती है।
दिस इज
जी सर, जैसे बहुत सारे डायग्नोसिस बनाने के लिए बहुत सारे सोफिस्टिकेटेड इंस्ट्रूमेंट्स की जरूरत पड़ती है, बहुत सारी पैथोलॉजिकल इन्वेस्टिगेशन की जरूरत पड़ती है। खास करके मैं अगर अपनी एग्जांपल दूं, अल्सरेटिव कोलाइटिस एक डिजीज है जिसको मैं डील कर रहा हूं बहुत सालों से। उसका डायग्नोसिस कोलोनोस्कोपी से ही पॉसिबल है और उसकी बायोप्सी कोलोनोस्कोपी वो आयुर्वेद में हम लोग उसको पकड़ ही नहीं पाते। तो उसकी मैंने बहुत साल ऐसे ही प्रैक्टिस की कि डायग्नोसिस मॉडर्न तरीके से करें और ट्रीटमेंट आयुर्वेदिक करें। लेकिन मैं अपनी एक वीकनेस बता रहा हूँ कि मैं आयुर्वेदिक डायग्नोसिस सीख ही नहीं पाया। मतलब मॉडर्न मेरे लिए बड़ा आसान था, हालांकि चिकित्सा करते हुए थोड़ा बहुत वातपित्त कफ का कॉन्सेप्ट हम लगाते हैं, लेकिन जो मॉडर्न डायग्नोसिस है वो मैं समझता हूँ बहुत स्टीक होता है। अगर जैसे रोमेटॉइड आर्थराइटिस को अगर डायग्नोज करना हो मॉडर्न तरीके से, उसकी सिम्टोमेटोलॉजी, उसके टेस्ट बहुत आसान है। लेकिन कई बार हम लोग फंस जाते हैं। थोड़ा इसके बारे में भी गाइड करिए आप। थैंक यू सर।
कैसा है ना कि मैं ये
जी सर, अपन डिस्कशन सेशन में इसको ले लेंगे।
जरूर जरूर जरूर।
हाँ, तो डिस्कशन अभी बाकी है सर।
जरूर जरूर जरूर।
So now I would like to welcome Dr. Venkat Dharmadhikari ji. Welcome sir, welcome on this platform, and welcome Dr. Shilpa Yerme ji. Kindly unmute yourself, Shilpa ji. Welcome. Yes,
sir. Namaskar. Namaskar. Good evening to all.
Welcome on AYUSH SAMRIDDHI platform. Welcome.
Yes, namaskar, sir. Namaskar.
Namaskar, namaskar. Now stage is yours, madam. Congratulations for world record. Congratulations.
Thank you very much. Thank you, sir. Thank you. Actually, namaskar, Madan ji. Patarkar sir, namaskar. नमस्कार सभी, डॉक्टर हरीश सर नमस्कार. सो एक्चुअली मैं थोड़ा मतलब बाहर थी, जस्ट की लिंक नहीं आए, सो आई थॉट कि कुछ पोस्टपोन हो गया प्रोग्राम. तो जस्ट मैं एक थोड़ा सा यहाँ पर अपना कुछ जो भी अनुभव है या जो भी एक सक्सेसफुल जो आज का टॉपिक है, इसके साथ में थोड़ा सा यहाँ पर मेरे जो अनुभव है उसको मैं बताना चाहूंगी. सो नमस्कार सभी को. आई थिंक ये एक गुड आयुर्वेदिक प्रैक्टिशनर के लिए यूजी यानी फर्स्ट ईयर से लेकर जो भी हम लोग पढ़ाई करते हैं, जैसे आयुर्वेद में तो विस्तारित रूप से आचार्य चरक एवं सुश्रुत ने दक्षे स्त्रीतार्थ शास्त्री स्त्री या चतुष्पाद वगैरह के बारे में वो डिटेल में बताया है. बट प्रैक्टिकल लेवल पर गुड प्रैक्टिशनर बनने के लिए या आयुर्वेद चिकित्सक के रूप में किस प्रकार से अपने आप को डेवलप करें, इसके शुरुआत जो है इट्स लाइक कि फर्स्ट ईयर से ही स्टार्ट होता है. तो एकेडमिक्स आर आल्सो इम्पोर्टेंट. बहुत बार ऐसे देखा जाता है कि जो मेरिटोरियस स्टूडेंट्स होते हैं ना, कि वो कहीं रह जाते हैं पीछे और फिर बाद में अचानक प्रैक्टिकल लेवल पर या प्रैक्टिकल लाइफ में जो कॉलेज में बहुत ज्यादा कुछ हाईलाइट नहीं होते हैं, ऐसे बच्चे भी प्रैक्टिकल लेवल पर बहुत अच्छा कर पाते हैं. तो कई बार जैसे मेरे ख्याल से वुमेन्स के साथ फीमेल्स के साथ ये बहुत बड़ा एक ऐसा हो जाता है कि हम लोग एकेडमिक्स में बहुत अच्छे हो जाते हैं, वहां पे हम लोग बहुत पढ़ाई करते हैं, बट बाद में कुछ रीजंस के चलते इतना प्रैक्टिकली हम लोग इम्प्रूव नहीं कर पाते, ज्यादा टाइम नहीं दे पाते हैं. तो इसके कारण कई बार ये भी हो जाता है. बट स्टिल आई थिंक कि फर्स्ट ईयर से लेकर सारे जो भी सब्जेक्ट्स है, थ्योरी हमारी अच्छी होनी चाहिए. और थ्योरी के बाद जो इंटर्नशिप का प्रोग्राम है, अभी महाराष्ट्र में इंटर्नशिप की प्रोग्राम की बात करेंगे तो देयर आर लाइक 6 मंथ का हमारा जो ट्रेनिंग होता है वो कॉलेज में होता है. देन 3 months इन द लाइक गवर्नमेंट म्युनिसिपल कॉर्पोरेशन के म्युनिसिपल कॉर्पोरेशन का जो भी हॉस्पिटल होता है ना, उसमें 3 महीने का ट्रेनिंग होता है. 3 महीने का जो होता है पीएससी यानी प्राइमरी हेल्थ सेंटर में एक ट्रेनिंग होता है. तो ये एक मुझे लगता है दिस इज द गोल्डन पीरियड ऑफ लाइफ, जहां पर जो भी बातें अपने कॉलेज टाइम में नहीं पढ़ी होती उसको रिवीजन करने का, प्रैक्टिकल लेवल पर सीखने का ये बहुत अच्छा समय होता है. तो इसका प्रॉपर यूटिलाइजेशन करना बहुत जरूरी है. आजकल कॉलेजेस के हालात देखे जाए या प्रैक्टिकल, जैसे हमने भी इसी तरीके से पढ़ा है कि वहां पर कुछ मुझे नहीं याद है कि मैंने एक ही डिलीवरी देखी थी मेरे गायनिक के पूरे 1.5 साल के दौरान, क्योंकि इतना उस समय पे शायद नहीं था. आज भी कुछ ऐसे कॉलेजेस होंगे, आई एम नॉट क्रिटिसाइजिंग एनी, बट स्टिल वहां पे भी काम करने की एरिया, वो भी काम करने का एरिया है. अगर हम लोग कॉलेज निकाल ले तो कॉलेज का पूरा इक्विपमेंट, स्टाफ और क्लिनिकल हैंड्स जो भी होना चाहिए, इस प्रकार से अगर वो डेवलप हो, सेटअप हो, तो ही इसका मीनिंग है. नहीं तो एडमिशन मिल जाता है, बच्चे बाहर निकल जाते हैं, तो बट आगे क्या है. तो गुड क्लिनिकल प्रैक्टिस के लिए आपको एक अच्छा गुरु भी बनाना जरूरी है. लाइफ में गुरु की बहुत ज्यादा इंपॉर्टेंस होती है. एक अच्छा गुरु क्लिनिकल प्रैक्टिस 1 साल के बाद, मेरा ये सजेशन है पर्सनली कि 1 साल इंटर्नशिप के बाद आपको और कुछ 6 महीने जो भी आपका विषय, जो भी आप चाहते हो, जैसे काय चिकित्सा में है, गायनिक में है, व्हाटएवर, वहां पे भी आपको थोड़ा कंसंट्रेशन के साथ 24 आवर्स ट्रेनी डॉक्टर, एज ए ट्रेनी डॉक्टर अगर आप काम करते हैं तो उसका एक अलग अनुभव आपको मिल जाता है. और पूरा अगर आप अस्पताल या हॉस्पिटल या छोटा सा भी यूनिट अगर आप ओनली हैंडल करते हैं तो ये एक आपके लिए गोल्डन अपॉर्चुनिटी है. वहां पर किसी भी समय में पेशेंट आ जाते हैं तो उसको कैसे हैंडल किया जाए, इसको आप देखते हैं या आप उसको अनुभव कर लेते हैं, तो आपके अंदर एक कॉन्फिडेंस बिल्ड हो जाता है. गुरु की बात हो गई. हम लोग महाराष्ट्र में जब भी ये बातें करते हैं ना, तो वहां पे हम लोग क्या चाहते हैं कि गुड क्लिनिकल प्रैक्टिशनर बनने के लिए अपना खुद का एक जमीन, छोटा सा भी तो एक जगह हो, जमीन हो, जहां पर मेरा ये मानना है कि वैद्यों को अपनी दवाइयां खुद बनानी चाहिए. जो भी हमें प्रैक्टिस में लगती है, एटलीस्ट रॉ मटेरियल लेकर चूर्ण, गुटी वटी, कुछ कॉम्बिनेशंस अपने आप से बनाए, तो इसका एक अलग अनुभव, अलग एक इफेक्ट भी होता है पेशेंट्स के ऊपर. हमारे यहाँ ट्रेड है कि हम लोग ज्यादा से ज्यादा अपने आप में ही, ठीक है, आप प्रिस्क्राइब करो कुछ मेडिसिन, बट स्टिल आई बिलीव इन दैट कि जो पूरी, भले पूरी बोले का जो भी बोलना चाहे, बट सोसाइटी में, बट स्टिल हम वैद्यों को अपने आप की छोटी सी भी एक फार्मेसी को डेवलप करना चाहिए. व्हाटएवर जितना भी हमारा बजट है, हम गांव में हैं, हम बड़े शहर में, जो भी फैसिलिटीज अवेलेबल है उसके साथ ही हमें खुद का एक जमीन या एक फार्मेसी और एक जैसे कि हम लोग कृषि प्रधान देश से बिलोंग करते हैं, हमारे पास खुद की जमीनें होती है, तो इस जमीन में क्यों ना हम लोग बाकी तो सारे ये भी करते हैं ना, मतलब लाइक धान्य या अनाज को भी उगाते थे, इसी के साथ साथ थोड़ा सा हमको जो रॉ मटेरियल लगता है वो अगर हम अपनी जमीन से उगाए तो आई थिंक इट्स रियली फंटास्टिक थिंग कि खुद एक ओरिजिनल, जो आज ऑर्गेनिक फूड को लेकर इतना बड़ा बवाल खड़ा हो गया है कि ऑर्गेनिक, सब कुछ ऑर्गेनिक चाहिए, बट जब हम लोग कुछ लाइक ऐसे होता है ना कि हम इतने आदी हो चुके हैं इस केमिकल और पेस्टिसाइड्स के, तो इसीलिए मुझे लगता है कि गांव के जो भी वैद्य है उनको इसमें पहल लेने की जरूरत है और वो बड़े लेवल पर इसको अपनाए, बड़े लेवल पर इसको हर यहाँ पे सर्कुलेट करे, जो भी रॉ मटेरियल लगता है अपने दोस्तों को सारी, या कमर्शियल पॉइंट ऑफ व्यू से भी आप डील कर सकते हैं किसी बड़े संस्थान के साथ, या गवर्नमेंट की कुछ पॉलिसीज होती है, कुछ ग्रांट्स होते हैं, इसको भी लेकर आप अपना खेती जो भी उसमें आप डेवलप कर सकते हैं। ये एक बेसिक चीज बहुत जरूरी है मुझे लगता है। आई होप कि बड़े शहरों में जगह की कमी होती है, रेट बहुत ज्यादा होते हैं, तो शुरू में ये दिक्कतें आती है कि इतना बड़ा सब कुछ हम लोग नहीं कर पाते स्टिल, बट एटलीस्ट आप किसी सोर्सेस से तो ले सकते हैं, ओरिजिनल आपको ये मिलेगा, एक अच्छा गुरु, थोड़ी सी ये खेती। और एक मुझे यहाँ पे बताना जरूर मैं चाहूंगी कि आज पॉसिबल नहीं है स्टिल, बट अगले कुछ 10 सालों में ये शायद हो सकता है कि हर एक वैद्य का अपना एक छोटा सा भी लाइक जैसे गाय, हम लोग इसको गाय बोलते हैं, तो गौ जो बोलते हैं ना, आजकल पंचगव्य का एक बड़ा महत्व हो रहा है, पंचगव्य की चिकित्सा यानी ओरिजिनल दूध घृत, तो मेरे ख्याल से तो 70% ऑफ मेडिसिन और प्रिपरेशंस आर डिपेंडेंट ऑफ द मिल्क एंड द मिल्क प्रोडक्ट्स। तो क्यों ना हम लोग अपने खुद की एक गाय अपने यहाँ रख ले, तो जो ओरिजिनल सारी चीजें हैं, जैसे कि उसका जो ये होता है ना गोबर होता है, तो गोबर का भी प्रयोग हम लोग, जो हमारे प्रोडक्ट्स है, रसशाला जो हम लोग छोटी सी बनाएंगे, इसमें अगर ये ओरिजिनल गोबर को लेकर हम लोग धूप या जो भी लाइक फूट वगैरह देना होता है ना, उसको अगर हमने अपना लिया तो ये मतलब एक बड़ा ही अच्छा हो जाएगा। ये पॉसिबल नहीं मैं मानती हूँ, आज हम लोग फ्लैट सिस्टम में अपार्टमेंट्स में रहते हैं बड़े बड़े, जहां पर तो गाड़ी पार्किंग के लिए भी एक ये होता है कि कुछ रेंट देना पड़ता है, जगह का बहुत ही बड़ा ये होता है, इकोनॉमिकल रिसोर्सेज भी उतने बड़े चाहिए होते हैं, बट स्टिल आई बिलीव कि ये बहुत ही ज्यादा जरूरी है अपने आप से भी। दूसरा मुझे एक लगता है इसमें कि अपने जैसे एक न्यू जनरेशन जो है ना, इट इज मोर डिपेंडेंट ऑन द इन्वेस्टिगेशंस, तो अच्छा चिकित्सक बनने के लिए हमें इस प्रकार की दृष्टि को डेवलप करना चाहिए कि हम लोग ना खुद से निदान भी करें, लाइक डायग्नोसिस, दर्शन स्पर्शन पर जो और स्पर्शन परीक्षा, जो भी हमारे जो त्रिविध परीक्षा है, दशविध परीक्षा है, उन सभी का प्रयोग हमें करना है। वी आर मोर डिपेंडेंट ऑन द इन्वेस्टिगेशन आप करिए, बट डिपेंडेंट मत बनिए। और मुझे लगता है इससे हम लोग अपने आप को बहुत ज्यादा संकुचित कर रहे हैं कि रिपोर्ट्स देख लिया, ये एनीमिया का एचबी कम है तो चलो एचबी, बट इसका हिस्ट्री, इसको साइकोलॉजिकल लेवल पर काम करने की जरूरत है क्या? क्योंकि हम लोग आयुर्वेद चिकित्सक है तो हमें केवल फिजिकल बिहेवियर या फिजिकल चीजों के साथ नहीं, बट मानसिक रूप से भी उसको सक्षम बनाने के लिए, या उसको हेल्दी मेंटल लेवल पर भी सात्विक गुण बढ़ाने के लिए, हेल्दी बनाने के लिए भी हमें काम करने की जरूरत है, तो वहां पर भी हम लोग थोड़ा ध्यान देने की मुझे लगता है जरूरत है। और एक थोड़ा सा एक मेरा विषय भी रहता है और मैं इसके बारे में भी हमेशा बोलती रहती हूँ, अच्छा प्रैक्टिशनर बनने के लिए आपके पास ना सारी टाइप की जो भी टेस्ट पेपर्स है या जो आयुर्वेद के सारे परीक्षण पत्र है वो आप खुद से बनाइए, जैसे प्रकृति है, धातुसार है, मनोबल परीक्षण है, कोष्ठ है, अग्नि है। आई थिंक दीज आर द बेसिस जो एलोपैथी किसी डॉक्टर के पास नहीं है। तो अगर आपने प्रकृति, धातुसार जैसे कंसेप्ट का इतना डीप स्टडी करके अगर उसको आपने अपना लिया, तो आप अपने आप से सभी वैद्यों से अलग भी हो जाएंगे। और हर एक व्यक्ति की प्रकृति निकाल दीजिएगा और उस प्रकृति के हिसाब से उसका बल देखकर वहां पे डोज कॉम्बिनेशंस जो भी आप चाहते हैं ना, उसके ऊपर काम करिए। आयुर्वेद चिकित्सक अच्छा बनने के लिए आप डिसीज को तो कम करेंगे, बट आज जैसे कि एलोपैथी में विटामिन कुछ एपेटाइजर्स लिख देते, तो उस समय वहां पर आप उस व्यक्ति की जो भी धातु सारता कुछ आपको हीन लगती है, असार धातु है, तो उस धातु का बल बढ़ाने के लिए भी काम करिएगा, तो फ्यूचर में पेशेंट आपसे कनेक्ट रहेगा। बाकी जैसे कि लाइक आई थिंक मेनी देयर आर मेनी थिंग्स, अपना पोलाइटनेस है, प्रामाणिक यानी रॉयल या रियल, या जो भी हमारा जो बिहेवियर होना चाहिए उस प्रकार से हमारा बिहेवियर सोसाइटी में, ये भी बहुत जरूरी है। आप पेशेंट से एक ऐसा हमारा एक अच्छा रिलेशन होना चाहिए ना, पेशेंट्स हमसे कुछ छुपाने नहीं चाहिए, मतलब इतना हम लोगों को अपनी पर्सनालिटी को डेवलप करना है, जस्ट लाइक कि उसको लगे कि हम किसी फैमिली फिजिशियन के साथ बात कर रहे हैं, तो वो आपको अपने इसका एक हिस्सा मान ले और इस प्रकार से आप उसको डील करिएगा, इस प्रकार से आप उसको हिस्ट्री लीजिएगा कि वो आपको पूरी सारी बातें बता दे। दूसरा मुझे लगता है कि हम लोग जब भी प्रैक्टिस करते हैं तो प्रकृति की बात मैंने इसीलिए की थी कि लाइक सत्व, रज और तम, त्रिगुण, महागुण इसको होता है। तो आपको पेशेंट की प्रकृति क्यों जाननी है, ताकि उसमें सत्व, रज, तम क्या है वो भी आप पहचान ले। अगर पेशेंट राजसिक है तो उसको ट्रिकफुली हैंडल करना होगा, बिकॉज लाइक पेशेंट्स आर प्रिटेंड टू बी ओवर रिएक्टिव। बहुत पेट दुख रहा है, डॉक्टर साहब पेट दुख रहा है बोलते हैं और फिर सर को हाथ लगा देते। सो देयर आर मेनी ड्रामेटिकल पेशेंट्स आर देयर, वी हैव टू डील विद। कुछ पेशेंट्स ऐसे होते हैं कि बहुत ज्यादा बड़ा चढ़ाकर बताने वाले हैं, तो वहां पर अगर हमने अच्छे से इन सभी बेसिक कंसेप्ट्स को जान लिया तो पेशेंट्स की सात्विकता, राजसिकता, तामसिकता के अनुसार भी हम लोगों को युक्तिपूर्वक चिकित्सा, जो प्रमाण बताए ना आयुर्वेद में, प्रत्यक्ष, अनुमान, युक्ति, मुझे लगता है आयुर्वेद का हर चैप्टर अपने आप में हमारे लिए गुड प्रैक्टिशनर बनने के लिए इम्पोर्टेंट है। आपको मतलब पदार्थ विज्ञान से लेकर सभी बातें। तो आई थिंक इसके साथ ही अगर हमने पहचान लिया पेशेंट सात्विक है तो वहां पर हमें ज्यादा कुछ प्रॉब्लम नहीं आएगी। पेशेंट जो भी आप बताते हैं ना उस प्रकार से उसको खा लेगा, पथ्य पालन करेगा वगैरह। बट पेशेंट अगर राजसिक, तामसिक है तो वहां पर जैसे युक्तिपूर्वक चिकित्सा करनी होगी, इस बारे में भी हमें सोचना होगा, इसको भी हम लोग ध्यान देंगे तो अच्छा रहेगा। और अपडेशन भी बहुत जरूरी है। एक जस्ट विद इन 2 मिनट्स आई जस्ट वांट टू से दैट आज की नई जनरेशन जो है, आई रिकमेंड दैट ऑल्सो कि हमें लाइक अभी ऑनलाइन मोड में हम लोग है ना, जैसे ये चल रहा है 2 साल से, तो आप प्रोपेगेंडा करिए, आप ऑनलाइन रहिए, आप जो भी आपका ये मार्केटिंग करिए, बट उसके साथ साथ लाइक रिजल्ट शेयर करना, कुछ अपने अनुभवों को शेयर करना, ये बहुत अच्छी बात है। बट तो थोड़ा सा इसके बारे में मुझे लगता है कि बहुत बार ऐसे हो जाता है कि बहुत ज्यादा प्रोपेगेंडा हो जाता है, बट उतना हमारे पास कुछ होता नहीं है। तो इस गूगल के ऊपर भी डिपेंडेंट हो जाना बहुत ज्यादा, तो इससे अच्छा है अध्ययन, जो संहिताओं को पढ़ना। और एक बात है कि हर गुड क्लिनिकल प्रैक्टिशनर के क्लिनिक में एक छोटी सी लाइब्रेरी हो, और उस लाइब्रेरी में चरक संहिता से लेकर काश्यप संहिता और लाइक जो हमारे शब्दकोश है, अमर शब्दकोश वगैरह, जिसमें शब्दों के अर्थ बताए गए हैं, डिक्शनरी हो, जो भी है, बेसिक चीजें हो, कल्प की किताबें हैं, भेषज रत्नावली है, सारे ऐसे सारे किताबों का भी संकलन अगर हमारे लाइब्रेरी हो तो हम लोग जब भी खाली समय मिल जाता है तो व्हाट्सएप और ये देखने की वजह से अगर हमने रोज एक सूत्र देख लिया, लाइक हमने रोज कुछ एक संहिता को पढ़ लिया, एक कोई भी अध्याय अगर माने, तो आई थिंक ये बहुत ही रिओरिएंटेशन के लिए भी अच्छा रहेगा। हम लोगों को एक स्टूडेंट की तरह से ही रहना है पूरी जिंदगी तक, आयु तक, और इसी के लिए पढ़ना भी जरूरी है। तो मुझे लगता है बहुत ज्यादा समय नहीं लेना चाहिए, एज कि यहाँ पे बहुत सारे स्पीकर्स रहते हैं। सो आई होप मेरे लिए तो बस, थैंक यू वेरी मच ऑल। ये और बहुत सारी बातें हैं बट स्टिल सभी सारे सीनियर लोग भी है यहाँ हमारे साथ, तो उनसे भी हम लोग सुनना चाहेंगे।
शिल्पा जी, थैंक यू वेरी मच। आपने महाराष्ट्र इज अ वेरी स्पेशल प्लेस शिल्पा जी, क्योंकि यू हैव द लार्जेस्ट नंबर ऑफ Ayurveda colleges in any one state in India.
Yes,
और आपके the Maharashtra parampara is also very special.
yes.
And there are many examples that the founding director of the Institute for Postgraduate Research in Jamnagar came from Maharashtra, from Pune,
Yes.
Mama Gokhale. And so your tradition is a very strong tradition, Joe. And what you have given us today, Shilpa ji, is a very practical set of recommendations. The point, which I particularly like, you must have a small library in your, and that is a very simple thing, but a very important thing. और दूसरा चीज जो प्रोफेसर रामदास जी जो हमारी प्रोग्राम में आते रहते केरल से, संस्कृत में हर एक शब्द की एक इसकी थोड़ा सा, I think, excite the students, storytelling, कहानी जैसा, just to share something. And Pavanji is already putting us in that mythology space कि कहानी है हर एक, इसमें हर एक औषधि के पीछे एक कहानी, कि मान लो हम लिया च्यवनप्राश की एक कहानी है, च्यवन मुनि, अब च्यवन मुनि रहते थे आज की हरियाणा की मेवात डिस्ट्रिक्ट के उस तरफ, दिल्ली के उस तरफ उनकी आश्रम है वहाँ, च्यवन मुनि का आश्रम. It used to be there, मेवात में. अब कपिला मुनि की कपिला कुंड जो कुरुक्षेत्र में, क्या चीज है, क्यों, why is it in Kapilam? So these are stories, and somehow we need to catch our young minds to come into our discussions and to feel excited about the story. ये खाली not only connecting with the past but also connecting with the future. आपने the one point you touched on is the manasika prakriti aspect. You know, it is not there. I think Harish ji will chat about it in our discussion. That manasika prakriti aspect is not available in modern medicine. उनके वो जो integration आपके आयुर्वेद, हमारे आयुर्वेद में जो है, and you put it very, very nicely. So thank you for touching on so many points, impromptu. Or I know you are a busy person, आपके college की you have responsibility, but if you can stay with us, थोड़ा discussion में, there will be some. I'm sorry that all your presentation was in Hindi. हमारे साथ है जी Sweden से Stina ji, and Stina की, don't worry, we have, she has your telephone number. Stina has come to, Stina knows Maharashtra well. She has been in Pune. She has been with Ranadeji in Pune, and she knows. But I think people like you, Stina ji, yourself, if you come together, you will give some new dimension to this transnational linkage for making a good Vaidya. And we continue, we will touch on this. If you stay with us till the end of the program, maybe in the discussion, Stina ji will have a question. Thank you for joining us today, Shilpa ji.
Yes,
We enjoyed your program on Nadi Pariksha. And that was also very, very exciting program. I hope the recording will be available for all of us. Pavan
Yeah,
ji,
I will send the link, sir. Just it is uploaded on the YouTube. I will send the link, sir.
thank you. And Pavan ji will organize another event with all of us, a big event, because there is something to be learned for the future about connecting physiology.
Definitely. Pavanji is a great person. He is doing very well in this pandemic and Ayurveda. So I hope, I'm looking forward. It's a big webinar offline also, sir.
Thank you, Shilpa ji. Thank you very much.
Thank you. Thank you. Namaskar.
Please stay with us if you can.
Yes,
Time permits.
yes.
Thank you. Pavan ji, thank you.
I would like to request Dr. Piyush Dwivedi. Piyush Dwivedi ji, यदि आप मुझे सुन रहे हैं, कृपया अनम्यूट कीजिए. जय हो, जय हो, जय हो. Welcome. Sir, Dr. Piyush Dwivedi is honorary physician to Governor of West Bengal and Nadi Visheshagya of West Bengal. Yes, he is pulse expert, very young, dynamic, and very busy. Roaring practitioner here. Great, excellent. Welcome, Dr. Piyush. Stage is yours.
Piyush ji, pranam. Welcome to our platform. Thank you for finding time in your busy schedule to be here with us. The floor is yours. We wait. We look forward to your presentation. Namaskar ji.
Namaste, Jai Shri Bharat, Vande Mataram, and all respect to all the seniors, and a guarantee to support all my juniors throughout my life whenever they need. So directly coming to the matter, first of all, I would like to give a huge heartily thanks to Sri Pavanji to give me this opportunity to be here and on a very great topic like the best Ayurvedic practitioner. So thank you so much to him from the core of my heart. And there are certain things which I want to stress in the first presentation. That number one is, I just want to share my own experience with you all without any decoration, without any painting and anything like this. So it is just a pure sharing of experience, what I used to do. And I will give you some data also, just to encourage my juniors or my colleagues or my brothers and sisters. I think I'm audible.
Piyush, we can hear you. We can hear you very
Thank you
clearly.
so
Thank
much.
you.
Right. So we can divide all this technique of becoming the best Ayurvedic practitioner, as per my experience, in three categories. Number one category is the inclusion criteria or the admission criteria. Second one is the marketing criteria, and third one is a good service providing with consistency criteria. So these are three criteria which I'm going to explain in a very short time. So first is inclusion criteria. What does it mean? See, our acharyas has said, Vidya Smriti Tatparata Kriya. This is the inclusion criteria for being a best, at least being a Vaidya. So when we are going to take admission or going to get entry into Ayurveda or Ayurvedic practice, the first criteria a student must have is the learning nature. They have to keep on learning. Keep on learning. It is never-ending process till your last breath. Number one. Number two is vitarko. So innovative thinking has to be there for all the students. क्योंकि जब तक आप किसी एक चीज पे एनालिसिस नहीं करेंगे, जो आपने दिया मेडिसिन, उस पे क्या रिजल्ट आया, उस पे नहीं सोचेंगे और कुछ नया करने के लिए नहीं सोचेंगे, ये इनोवेटिव थिंकिंग का आइडिया अगर नहीं है, so you are not going to be the best Ayurvedic practitioner. So third one is Vijnanam, and you have to love your Ayurveda, your science, your depth of your Ayurvedic knowledge, and you have to be very specific to the Ayurvedic philosophy. And third one is Smriti. So you have to have that wonderful memory, because it is a practice. We can increase our memory by different practices. And the devotion, we have to completely devote ourselves. And third is the kriya, and we have to take action. So these are the points which Charak has said in Sutrasthan. So these are the minimum criteria for being an Ayurvedic physician. So keeping all these things in view, we have to move forward. And the second thing is the marketing criteria. I just want to give one data. This is just to boost or encourage all the colleagues. Usually, I used to see 100 patients in a day. And by this, there is 2 to 3 months waiting to get another chance. Why I'm saying this to you? Because it is because of the marketing. What kind of marketing? You have seen, जब मैंने मेरा नाम दिया इसमें, तो वहां पे मैंने अपने क्लिनिक का भी नाम नहीं लिखा है. And I have never done any internet advertisement. I have never done any leaflet distribution, nothing. So where from marketing coming? So this marketing is completely different kind of marketing. We don't need any kind of leaflet or internet or social media marketing. We don't need any kind of board or such kind of things. When our knowledge, our practice, our devotion, our purity will be there for Ayurveda, your patient will be your marketing. So how we can achieve this? And whatever I'm saying, anyone is most welcome to come over here. They can feel, they can stay, they can learn along with me. Out of 100%, 95% are used to give a wonderful response. So, and they are the marketing person. They give the mouth-to-mouth publicity. So here, as the best Ayurvedic practitioner, we can take it in two ways. One is the spiritual aspect, that how we can practice ourselves in Ayurveda, how we should live and this and that. And second is how we can show our power of treatment and magic to the common people, those who used to believe only in allopathic system and allopathic power. So as my all beloved colleagues have said too much about the spiritual aspect and the ethical aspect, so I'm not going to speak too much over it, but I'll give you some practical examples just to input some boost to the practice of her colleagues. So the marketing criteria is basically the philosophical aspect or the behavioral aspect. So in that, first point is there has to be suchi, the purity. The Ayurvedic Vaidya has to have the very pure soul. They have to practice the spiritual practices in their home, like doing pranayam and yoga, to improve their energy and to improve the sensation under their fingers, to improve their energy, to know the vibration, and it is going to help in proper diagnosis, and it will give some amazing fruitful results also. So both the purity from mind and body, we need the both purity from mind and body. So everyone has to be very pure. First point. Second is the dealing with the patient. As we know, Maitri Karunyam Arm. So the patient, with the patient, because patient, when they used to come to us, they are already in fear, they're already in pain. And the most tragedy is this, that they have low Agni bal, they have low energy, they have low pocket bal. The only increased bal is Vyadhi bal when they come to an Ayurvedic physician. Fine, I think you are getting me. So they have low pocket bal, they have low mental bal, they have low Agni bal, they have low Dhatu bal. Only thing they have high is Vyadhi bal. At that situation, most of the patients used to come to us with a hope to do miracle, not to do the treatment. In that case, you are dealing with the patient. So hats off to all the Ayurvedic physicians, those who have carried this tradition till now, and now it is flourishing like anything. So heartiest congratulations to everyone, those who have contributed to this. So we have to show our love, affection, our friendliness, and our support to the patient. This is very much necessary, and we have to listen to them. We have to support them. So dealing patientfully, affectionately with the patient is very much necessary. And what I have to see, what I have experienced, there are different kind of practice methods. When we are doing practices in villages, there is different kind of practice. When we are practicing kind of system. So as I used to do practice in the city, so I'm just sharing with the experiences of city practice, because everyone, those who used to come, they are all educated, all economically balanced people in the city. So I'm just dealing with this one right now here, sharing with that system only. So we need to explain the patient about the disease process, how it happened, and what is going to be the prognosis, because they want to see your knowledge, they want to see your confidence level, because you know the prognosis. So you must have to know which patient to take, which patient to refuse, which patient to refer. So this, at least you have to have this confidence. And you can, even if your knowledge and experience is amazing, you can tell the patient that when he is going to be absolutely fine, when he's going to be, whether he's going to, is not curable. So all these things, they used to see their confidence. And when they are knowing that you are making them understand all the disease, the processes and what is happening, they feel that we are at the right place. So we need to explain the Vyadhi or the process in both the sense. We should use the modern terminologies also and the pathogenesis along with the Ayurveda, so that they can understand, because all the patient doesn't know your own terminology. We have to make them teach. We have to teach them. We have to tell them our terminologies, but we have to use just to make them understand about the modern pathogenesis also, because they'll get confidence about it. After that, they start correlating with this, all they need to explain. Next is the Nadi Pariksha, because see, personally telling, Nadi Pariksha can give you the huge popularity, number one. It is a huge attraction also. Number three, it immensely helps in diagnosis. because those who knows this only they can understand and feel the power of Nadi Pariksha. Fine. So when the people are bringing their reports, before their reports, you are explaining everything that your cholesterol level is at this level, your sugar level is at this level, or you have sugar, cholesterol, you have certain blockages in your coronary artery, you have high PSA level, or you have enlarged prostate, or whatever. They'll just become completely attracted and shocked to correlate with all these things. So it is wonderful, the Nadi Pariksha. So I would say every Vaidya must know the art of reading the Nadi Pariksha. And I think if, because here all the renowned persons are there, I'm a very little person, but through your platform, I just want an urging to everyone, start a course in our regular medical colleges, Ayurvedic medical colleges, to teach Nadi Pariksha and make it into the course, so that everyone get the chance to learn the Nadi Pariksha, because it is wonderful. Because most of the time when you are doing Prashna Pariksha, most of the patients cannot respond you properly the way you want. So determining the Vayu Pitta Kapha involvement in different diseases in different levels, you may get confused by the response of the patient. So at that case, one example, suppose someone is having ajirna, but as per patient verbal presentation, he is not able to explain properly, and as per him you are getting, it may be Viragdha Jirna. But Nadi is saying that it is Amajirna. When you are going to give the Amajirna medicine, it gets amazing benefit. So I have given you the smallest example, but it is going to be wonderful, and it is going to give a bloom to your practice. So please, everyone, start learning the Nadi Pariksha. And the next point is every Vaidya has to have the Piyush Pani. Although it is not a scientific word, but it has Shastra says the purity, the chastity, and the spiritual practice can make your hand auspicious. So although it is illogical, but it is the point, because I have experienced in my life that your purity, your spirituality will bring the amazing result. And you have to be Swayam Kruti. Just don't depend on anyone else. Try to build yourself by your own. And for this, you need a hard work. And for hard work, you will keep on learning. You will keep on learning. You will keep on seeing different cases. You will keep on doing the innovative, making the innovative thinking. Because when you are self-made, you are like a diamond. And self-made needs a huge hard work. And it will force you to learn different textbooks and different practices. And soon, that means you have to be correct. Are your own marketing criteria, without any leaflet, without any social media advertisement. You will definitely get the mouth-to-mouth publicity by all these criteria, and it is a behavioral criteria, philosophical criteria. Now coming to the last point, the good service providing with consistency. So when you are doing this, what I told you, all these criteria of marketing with good behavior and all this thing, whatever I said, patient may come to you 2 times, 3 times because of your attraction, but they cannot be regular, or they cannot pass out many more patients to you until you are not showing the result. So for giving the results, you need to give a consistent good service criteria. And for this, यहाँ पे मैं चाहूंगा कि जो भी मेरे जूनियर्स होंगे या जो भी, ये थोड़ा ध्यान से सुनेंगे. Very practical thing. I told you I just want to share my own experience without any decoration. मेरे ख्याल से हमें इसको 2 लेवल में देखना चाहिए, 2 डिवीजन में देखना चाहिए. One is disease and second is the medicine. डिजीज का मतलब है अभी का जो ट्रेंड है, हम लोग इसको 2 भागों में डिवाइड कर सकते हैं. एक कि आप किसी एक बीमारी के एक्सपर्ट हो गए हो, और एक आप मैक्सिमम बीमारी को कवर करते हो. हाउ वी कैन गेट द मैक्सिमम पेशेंट एंड हाउ वी कैन गिव मैक्सिमम बेनिफिट टू द पेशेंट. सी द मोस्ट कॉमन डिजीजेस which any allopathic doctors used to get is diabetes mellitus, dyslipidemia, hypothyroidism, allergic rhinitis, sinusitis, osteoarthritis, rheumatoid arthritis, IBS, constipation, COPD, prostate, psoriasis, eczema, vitiligo, and psychiatric disorders. So these are the common diseases which used to come to us. So to get the popularity, to get the name and fame, you have to be the master of all these diseases, so that ये एक नाम होना चाहिए कि हर पेशेंट, आप जिस शहर में रहते हो, आपके पास आता हो शुगर के लिए, आपके पास आता हो कोलेस्ट्रॉल के लिए, और ऑल दिस डिजीज व्हिच आई हैव मेंशन्ड. क्योंकि जो आज के जमाने में जो पेशेंट हैं, उनके दिमाग में है कि sugar can treat only by the allopathic doctors, cholesterol can be treated only by the allopathic doctors, and such kind of things. But you have to have the specific knowledge regarding this disease and how to control this, and with a short period, because good practice के लिए जो बहुत जरूरी है, disease पे command, proper diagnosis, dealing, how to deal with the patient, give prompt action result, आपको तुरंत दिखाना होगा. इसलिए मैंने बोला था कि अगर हम लोग प्रैक्टिकल एस्पेक्ट ऑफ बेस्ट प्रैक्टिशनर का देखें, स्पिरिचुअल एस्पेक्ट नहीं बोल रहा हूं मैं, आयुर्वेदिक सिर्फ आयुर्वेदिक एस्पेक्ट नहीं बोल रहा हूं मैं, प्रैक्टिकल एस्पेक्ट, तो आपको ये डिजीज कवर करने ही पड़ेंगे, बिकॉज मोस्ट ऑफ द पॉपुलेशन ऑफ आवर इंडिया इज सफरिंग फ्रॉम डायबिटीज, डिस्लिपिडीमिया, पीसीओडी, हाइपो. यू हैव टू कवर दिस डिजीज विद अ वेरी गुड कॉन्फिडेंस, एंड दैट मैं फिर से यहाँ पे डेटा देना चाहूंगा कि I used to see, मैं आप लोगों के लिए थोड़ी देर पहले निकाल रहा था, चेंबर में ही मैं अभी भी हूँ, 1200 पेशेंट इन अ मंथ फॉर डायबिटीज ओनली, एंड आउट ऑफ 1200 1000 पेशेंट इंसुलिन डिपेंडेंट थे, जो अभी इंसुलिन डिपेंडेंट नहीं है. ये हर महीने का मैं डेटा बता रहा हूँ आपको. फाइन. सो ये कॉन्फिडेंस आपको दिखाना होगा कि हाउ वी कैन ट्रीट डायबिटीज, हाउ वी कैन ट्रीट कोलेस्ट्रॉल, एंड विद इन शॉर्ट पीरियड. ऐसा नहीं कि 3 महीने 6 महीने में ये काम हो रहा है. वी हैव टू शो इट. So how we can show it, I will tell you when the medicine part will come. So, but we have to majorly cover this disease. So these diseases which I have mentioned, आप लोग जब इसको रिवाइंड करके सुनेंगे तो आपको फिर से वो डिजीज के नाम आ जाएंगे सामने. ये डिजीज आपको कवर करना होगा. और दूसरा डिजीज का जो पार्ट है वो है जो ऐसी बीमारियां जहां पे जो बीमारी आपको सीधे सीधे भगवान के कंपैरिजन में लाती है, आपको सीधे सीधे हीरो बना सकती है. वो बीमारियां हैं सीकेडी, कैंसर, हाई लेवल ऑफ एक्सट्रीम पीएसए, मायस्थेनिया ग्रेविस, मल्टीपल स्क्लेरोसिस, मस्कुलर डिस्ट्रॉफी, एमएनडी, ऑटिज्म, इनफर्टिलिटी, और लाइक डीप वेन थ्रोम्बोसिस, सच काइंड ऑफ डिजीज जहां पे आप एकदम से करके दिखाते हो और यू बिकम हीरो. सो broadly we can classify this disease into 2 parts. One is the medicine which the disease which can give you the popularity and maximum number of patients. So you have to have a command over those diseases by learning and all the rest of the things I will tell you. And second is that rare diseases where there is not at all, where you are showing amazing results, which I have mentioned right now. So it can make you a wonderful best practitioner, even ulcerative colitis, Crohn's disease, such kind of disease. So divide these diseases into 2 parts. There are many more methods. I'm expecting this, like doing panchakarma, like doing agni karma, and so many methods are there. But I am just sharing the way I used to do in a clinic. Patient आते हैं, दवा ले आते हैं, they are showing the results. So when the second aspect and the last aspect is the medicine. I think when we are going to be very competitive with any other system of medicine, number 1 point for the medicine is please prescribe less medicine. क्योंकि जनरली हम लोग जो प्रैक्टिसेस में देखते हैं, एक बीमारी के लिए बहुत सारी मेडिसिन देते हैं. तो प्लीज प्रिस्क्राइब लेस मेडिसिन. व्हाई लेस मेडिसिन? It is very easy for the patient and not irritating to take. And how we can do this? By proper knowing the medicine for the disease. As for example, suppose a patient coming to you with a headache. Just you have to have a specific knowledge if the headache subsides. I am giving you examples to just encourage you, because if you know medicines properly, if you have learned different texts for single medicine, you will know the secrets, because all the secrets are there in the book. We can learn the secrets by two methods. Yes, and a very opportunity, you have got the opportunity to be along with a wonderful guru, or you have to read different texts on a single medicine. Like when someone is suffering from headache, if the headache is subsiding after vomiting, just prescribe Kamdudha. If the headache is not subsiding after vomiting, give Sutse Kharrat. Fine. Like Mrityunjay, what we used to know, cough and cold hone pe, bukhar hone pe de dete hain. But read the different books also. It is written clearly, when someone is having puya meha, pus cells in the urine and having heavy temperature, very high temperature, it can cure within 2 days. Use it and try it and see the magic. So Mrityunjay Ras एक book में कुछ फलश्रुति है, किसी और book में extra है. So try to read different texts on same medicine. जैसे चरक ने कहा था ना कि द्रव्यज्ञ वैद्य से श्रेष्ठ होता है युक्तिज्ञ वैद्य. So use your युक्ति. आपको बहुत सारे मेडिसिन नहीं जानने हैं, कम जानने हैं, बट उसका डिटेल नॉलेज रखना है बाय रीडिंग बहुत सारे टेक्स्ट. श्रुते पर्यावरत्वम बहुसुदृष्ट कर्मता, बहुत सारे बुकों को पढ़ना होगा एक ही मेडिसिन को लेके. देन यू कैन नो द एग्जैक्ट थिंग्स. लाइक अगर कोई अपस्मार या तंत्रक का पेशेंट है, उसको साइकेट्रिक पेशेंट है, अगर वो हार्मोनल प्रॉब्लम से हो रहा है, स्मृति सागर रस, अगर उसमें अग्रेसिव बहुत ज्यादा हो जाता है, तप्यादी लॉ, सो वी कैन distinguish it and give a proper drug of choice, best medicine. So we can give only a very few medicine by knowing all these things. Medicine has to be palatable. वो थोड़ा palatable होना चाहिए. अभी तो बहुत सारे कंपनीज ने इसको palatable बना दिए हैं. Easy to take होना चाहिए and प्रतिपत्तिमान. पेशेंट, डॉक्टर को ये एक presence of mind होना चाहिए when to use, how to use the medicine. And we have to have the proper knowledge of diagnosis and selection of medicine has to be on Ayurvedic concept only. Suppose मैं फिर से एग्जांपल देता हूँ just for improving the giving the idea. अगर पोटेशियम बढ़ा है, treat it like a vayu. अगर सोडियम बढ़ा है, treat it like kapha. प्रोटीन अगर निकल रहा है, it is ojomeha. So puyameha. So there is specific medicine, single medicine for all these things. So all the secrets are there. Chandransuras, Garbhachuti. So when there is uterine prolapse, you are giving Chandransuras. So these are wonderful things. लास्ट में मैं कुछ सीक्रेट शेयर करके अपना बात को खत्म करना चाहूंगा. कुछ मैं यहाँ पे श्री श्रद्धेय पवन शर्मा जी हैं, बहुत बड़ी बड़ी कंपनियां हैं. मैं उन सबसे अनुरोध करूंगा कि एक ही दवा सभी लोग बनाते हैं, जबकि एक से एक मैजिकल दवाइयां हैं जो तुरंत और बहुत बड़े काम करते हैं. उसको बनाना जरूरी है, क्योंकि सपोज अगर वादगजांकुश डाबर बनाता है तो वही झंडू भी बना रहा है, वही वैद्यनाथ भी बना रहा है, वही सभी बना रहा है. There are magical medicines which can show amazing results. Like सूतिका भरण रस, उसको डिफरेंट तरीके से पढ़ना होगा. सूतिका भरण रस इज अ वंडरफुल मेडिसिन. मैं जानबूझ के सीक्रेट शेयर कर रहा हूँ. सूतिका भरण रस हम लोग जानते हैं कि सूतिका रोग के लिए बहुत अच्छा है, बट इट इज अ वंडरफुल मेडिसिन फॉर चॉकलेट सिस्ट एंड हेमरेजिक सिस्ट. इट कैन शो डेफिनेट मैजिक. जैसे अनकंट्रोल्ड डायबिटीज में केसरी रस, प्रमेह, चिंतामणि रस, वेद विद्यापति, कहीं मार्केट स्टॉप द इंसुलिन, मस्कुलर डिस्ट्रॉफी, दसोसार. सो ऑल दिस थिंग्स. हम लोग जो राइनाइटिस के प्रॉब्लम होते हैं, सभी लोग सिर्फ लक्ष्मी विलास वहां तक लिमिटेड रहते हैं. ये बसंत तिलक रसा, इट कैन गिव यू रिजल्ट इंस्टेंटली, बट कोई नहीं बनाता. नित्यानंद रस इज वंडरफुल. वी नो इट्स फॉर स्लीपर्स, बट इट इज वंडरफुल फॉर डीप वेन थ्रोम्बोसिस. वी शुड नो द स्पेसिफिक इंडिकेशन. बोलबद्ध रस, अधर रक्तपित्त, इट इज वंडरफुल, बट हर जगह बोलबद्ध नहीं चलेगा. फिर ये रक्तपित्त, अर्केश्वर रस, जहाँ पे कैंसर की वजह से ब्लीडिंग होता है. रक्तपित्त कुलकुंडल रस, जहाँ पे तिर्यक गति में होता है. सो मेडिसिन itself has wonderful power to cure everything, but the only thing is this, the only criteria is this: you have to be very pure. We have to devote ourselves for the Ayurveda. We have to keep on learning, but एक मेडिसिन को different टेक्स्ट में पढ़िए. There is all the secrets within it. उन दवाइयों को मास लेवल पे बनाइए. हर कंपनी को बनाना चाहिए ताकि सबको ये फायदा मिले. ताकि ये जान सके कि ये जाता है और काम करके दिखाता है। नाड़ी परीक्षा पूरे कॉलेजेस में कंपलसरी हो ताकि प्रॉपर डायग्नोसिस हो सके, और इस हर फील्ड में उस रिपोर्ट को, रिजल्ट्स को दिखाएं। आप 5 दिन में पोटेशियम कम कर सकते हैं, आप 5 दिन में प्रोटीन, 6 दिन में प्रोटीन को कम कर सकते हैं, इफ यू नो द प्रॉपर एक्शन ऑफ द मेडिसिन विथ वेरी फ्यू मेडिसिन। सो मैं जानबूझ के, क्योंकि बाकी एस्पेक्ट को बहुत लोगों ने कवर किया था, मैं सिर्फ प्रैक्टिकल बातों को यहाँ पे रखा, जो मेरा जो थोड़ा एक्सपीरियंस था। किसी का भी कोई क्वेश्चन हो सकता है किसी भी डिजीज को लेकर, जो मैं, धन्यवाद।
Thank you, Dr. Piyush. Excellent. In very fast pace, you have excellent views and practical views, applied views, no doubt applied views. Really,
बहुत धन्यवाद।
next generation must be inspired with your expertise and experience. Must be inspired. Thank you. Thank you. And please join whenever you have time. Please join us. Please join us. This platform is yours. And we are here for non-commercial, because as you are also observing in our pamphlets, no imami, no jhandu, nothing. I have already retired. So no imami, no jhandu. This is absolutely non-commercial, scientific, brainstorming platform where we share our thoughts freely and frankly. Thank you. Thank you, Dr. Piyush.
थैंक यू लॉर्ड सर, बहुत बहुत धन्यवाद मुझे बुलाने के लिए और ये मौका देने के लिए।
Thank you. Thank you. Madan sir.
Madan sir is not there. He has left the meeting because he has scheduled one meeting in Kerala at 8 p.m. in Indian Standard Time.
Oh.
So I left the platform.
Then I would like to request Dr. Bagga. Dr. Bagga ji, welcome. Dr. Sudhir Bagga ji, welcome.
हाँ जी, welcome. Thank you.
Welcome sir, welcome.
Thank you.
आज नए साल में दर्शन दीजिए। लोहड़ी की शुभकामनाएं आपको, बहुत बहुत शुभकामनाएं।
हाँ जी, एक सेकंड। आप सबको शुभकामनाएं, नए साल की मुबारक हो। ये जो आप कर रहे हैं बड़ा अच्छा है। मैं मदन से अभी पता चला तो आई थॉट आई जॉइन फॉर फ्यू मिनट्स। ये जो मैंने अभी थोड़ी देर पहले ही ज्वाइन किया, तो आप जो कर रहे हैं इट्स प्रोबेबली वेरी हेल्पफुल फॉर न्यू प्रैक्टिशनर्स। एंड जैसे अभी उन्होंने कुछ नाड़ी परीक्षा के बारे में थोड़ा बात करी, आई थिंक उसको जैसे हम साइंटिफिक तरीके से वैलिडेट करें, जैसे मैं पहले भी बोल चुका हूँ, वो एनहांस करेगी इंटीग्रेशन ऑफ ऑल द बेस्ट मेडिकल सिस्टम्स टुगेदर। अब आजकल नाड़ी परीक्षा जो है इवन दो पढ़ाई जाती है, बट आई डोंट थिंक इतने लोग प्रैक्टिस करते हैं और दे आर नॉलेजेबल इनफ टू मेक द करेक्ट असेसमेंट। तो उसको अगर हम जैसे मैं अभी हार्ट रेट वेरिएबिलिटी से बैंड बनाकर कोशिश करें, पीपीजी फोटोप्लेथोस्मोग्राफिक से हम उनको असेस कर सकें 24 घंटे तक रख के, आई थिंक वो एक आयुर्वेद को और अदर सिस्टम्स ऑफ मेडिसिन जैसे चाइनीज भी करते हैं, तिब्बतियन भी करते हैं, उसको एक साइंटिफिक मोडालिटी में बहुत अच्छा रहेगा। और जो भी लोग इंटरेस्टेड हैं इस फील्ड में आने के लिए, तो आई थिंक दे कैन कांटेक्ट मी, क्योंकि मेरा तो प्राइम एम तो यही है कि किसी तरीके से हम अदर मेडिकल सिस्टम, स्पेशली आयुर्वेद, कैन बी ब्रॉट इनटू द concept of understanding with the physicians or the allopathic mindset people or scientists. तो वो बड़ा important है। लेकिन I think students के लिए practical applications and information given was wonderful. Thank you.
Thank you, sir. Thank you very much for your nice blessings. Now I would like to request Dr. Harish Verma ji, and then Stina. Please don't go away, Stina. Dr. Harish Verma, sir.
मेरा वीडियो शुरू नहीं हो रहा था. थैंक यू. डॉक्टर सुधीर जी नमस्कार. सर आप मॉडर्न मेडिसिन से हैं और आपने पल्स डायग्नोसिस पे भी काम किया है और मैं समझता हूँ थोड़ा आपने वात पित्त कफ के हिसाब से भी कुछ जो बैंड डेवलप किया है. थोड़ा सा इसके बारे में बताइए कि हाउ यू एनालाइज Vata Pitta Kapha from or how you differentiate modern diagnosis and Ayurvedic diagnosis?
ये तो टॉपिक बाय इटसेल्फ है. आपने पूछा तो
2 लाइन्स में छोटा सा आंसर.
नाड़ी के लिए हम जो 3 उंगलियां रखते हैं
जी,
मतलब मैं आपको अपनी सोच बता रहा हूँ. तो मेरा जहां तक पर्सनल थॉट प्रोसेस है कि many years ago जो भी हेल्थ प्रैक्टिशनर्स आयुर्वेद थे उनको obviously they had some knowledge which they gained from putting 3 fingers onto the radial artery, and they probably statistically validated different symptoms and put it together and then made some sort of conclusions about it. एग्जाम्पल मैं थोड़ा सा दे सकता हूँ. जैसे कि एक मरीज अगर मेरे पास आए और वो पॉलीयूरिया, पॉलीडिप्सिया, पॉलीफेजिया बोले, इंक्रीज थर्स्ट, इंक्रीज हंगर, इंक्रीज यूरिनेशन, तो हम सोचते हैं कि वो डायबिटीज है. हम फिर उसको ब्लड शुगर टेस्ट कराते हैं, हीमोग्लोबिन A1C करते हैं. तो मेरा ख्याल है कि ऐसे सिम्टम्स लेकर 1000 साल, 500 जो भी साल पहले लोग आए तो आयुर्वेद ने उनको देखा, फिर उनको, बिकॉज दिस इज द मोस्ट सुपरफिशियल ब्लड वेसल इन द बॉडी और नीचे बोन है तो इट्स इजीली पैल्पेबल रादर देन कैरोटिड और अदर्स. So they must have tried to figure out what is going on inside the body because this was palpable and easily done. Or what symptoms came with polyuria, polydipsia, polyphagia, and they felt it. And then they felt some different vibrations. और उसके मुताबिक उन्होंने symptoms देखकर, tongue देखकर, urine देखकर, सारी चीजें मिलाकर उन्होंने, they must have treated, managed in whatever best ways they could. Then, or obviously they tried to go and see different patients, तो उनको vibrations वात पित्त कफ की अलग मिलती थी, constitutional of the patient, but disease based, there was some consistency in those vibrations. So next time, after many experiences, a patient would come and they felt only the vibrations. They would have told the patient कि आपको बहुत ज़्यादा पेशाब आता है, या भूख लगती है, या बहुत ज़्यादा प्यास लगती है. तो patient would have been saying, amazing, मैंने तो बताया नहीं इनको कुछ. So उस information को, obviously it's coming right here. और हम डॉक्टर मेडिकली सिर्फ उसको कार्डियोवैस्कुलर देखते हैं. आयुर्वेद, चाइनीज, तिब्बतियंस, they can diagnose diseases besides the constitution. ये मेरी thought process है कि वो हम heart rate variability से 24 घंटे बैंड लगा के हम उसके different time periods में, जैसे हमारे वात पित्त कफ का different time zones है, time periods हैं. Chinese में भी 12 meridians and different clocks है. Liver gets activated between 1 and 3 in the morning and kidneys from 5 to 7 in the evening. मतलब there are different times. मेरी सोच ये है कि अगर हम वो 24 घंटे के लिए रखेंगे, अभी डिजीज हुआ नहीं है, डिजीज होने के बाद तो आपको पहले पता चलेगा, लेकिन डिजीज नहीं हुआ तो वो अगर मशीन रखी है, बैंड रखा है, तो अगर उसको कुछ लिवर डिसफंक्शन हो रहा है और अगर हम ये मान लें कि लिवर इज ए पित्त ऑर्गन, हम मान लें वो 1 and 3 in the morning हो रहा है, फ्रॉम द इंफॉर्मेशन गैदर्ड फ्रॉम ऑल ओवर द वर्ल्ड, उसको एक्सेप्ट अगर कर लें, तो वो जब वाइब्रेशंस और जो फ्रीक्वेंसी डोमेन में थोड़ा साइंटिफिक माइंडसेट है, उसमें लो फ्रीक्वेंसी, हाई फ्रीक्वेंसी, वेरी लो फ्रीक्वेंसी एंड इवन अल्ट्रा लो फ्रीक्वेंसी, So low frequency correlates to pitta, correlates to somewhat sympathetic activities. Suppose between 1 and 3 in the morning there was a liver dysfunction. That low frequency percentage would be higher than the rest of the 22 hours. So we can assume, गलत तो पता नहीं, अभी टाइम बताएगा कि तुमको लिवर डिसफंक्शन है. Obviously वो पेशेंट मरीज के पास, डॉक्टर के पास जाएगा, डॉक्टर ब्लड टेस्ट करेगा, नेगेटिव होगा, बिकॉज अभी तो माइनर चेंजेस हो रहे हैं, सिर्फ फिजियोलॉजी और पैथोलॉजी में बन रही है. तो हमने उसको बोला कि कोई प्रॉब्लम नहीं, ये पित्ता ऑर्गन है, तो आप लेफ्ट नॉस्ट्रल ब्रीथिंग 4 to 6 breaths per minute, 3 to 5 minutes, 3-4 times a day करें. That will increase your kapha activity, somewhat decrease your pitta activity, sympathetic activity. आप करके देखो, do it 3 or 4-5 times a day. और उन्होंने किया. Suppose पहली बात वो करेंगे, पता नहीं क्या, डॉक्टर के पास जाएंगे, डॉक्टर कहेगा कुछ नहीं है, वो कहेगा ऐसी है, डोंट वरी. फिर अगले दिन लेकिन वो क्लाउड में इंफॉर्मेशन जाती जा रही है. पहले 48% आया, उसे कुछ नहीं किया, वो 52% हो गया, उसको लगा, मतलब परसेंटेज बढ़ गई, लेकिन उसको कोई फीलिंग नहीं हो रही, नो राइट साइडेड पेन, नथिंग, नो सिम्टम्स, लेकिन उसको एक नंबर बढ़ता नजर आया. फिर वो डॉक्टर के पास गया आफ्टर 2-3 months. फिर डॉक्टर ने बोला मैंने आपको बता दिया ना, आपको कोई प्रॉब्लम नहीं है. उसने ब्लड टेस्ट दोबारा किया, अगेन नॉर्मल. अब उसकी परसेंटेज 56% हो गई है 48 से. अब उसने सोचा कि ये आसान सा काम, ये लोग बोल रहे हैं लेफ्ट नॉस्ट्रल ब्रीथ कर लो, मैं कर लेता हूँ. इनहेलेशन शुड बी लेसर देन द एक्सहेलेशन, 1:2 रेशियो पॉसिबल. तो उसने किया, तो वो जो परसेंटेज थी 58 वो 53 आ गई. उसको अभी कोई सिम्टम्स नहीं है, लेकिन वो परसेंटेज कम हो गई. एक ने किया, कुछ नहीं, मतलब symptoms improved and probably mild liver dysfunction treated by itself, अगर वो obviously is not causing more damage by liver, alcohol and other things. एक ने नहीं किया, वो 6-7 महीने के बाद उसको राइट अपर क्वाड्रेंट एंड द एब्डोमेन में दर्द शुरू हो गई. फिर वो डॉक्टर के पास गया, उसी के पास, आफ्टर 8 to 10 months. तो उसने बोला डॉक्टर साहब मेरे को यहाँ पे ना थोड़ी दर्द हो रही है. उसने लिवर फंक्शन टेस्ट किया, एबनॉर्मल निकले. तो मरीज ने बोला डॉक्टर साहब मैं आपके पास 6 महीने पहले आया था, फिर 3 महीने पहले आया था, आपने बोला कुछ नहीं है. तो ये पता नहीं ये क्या साइंस ऑफ लाइफ एक अजीब सी चीज कर रही है यहाँ पर. Then the doctors, scientists will get involved and interested in the process. ये मेरी सोच है, और काफी स्टडीज इसमें हैं, तो anybody who wants to get involved can get involved. क्योंकि मेरी सोच ये है कि there are lots and lots of medicines and they are beneficial for many diseases. अगर बहुत अच्छे आयुर्वेद के पास, मैं काफी लोगों को मिला हूं, झंडू या डाबर या आयुष ने 15-16 जड़ी बूटियां मिला के डायबिटीज के लिए दे दी. मेरा सिंपल सवाल उनको ये होता था हमेशा कि आपने 16 की जगह 15 या 14 या 13 या 10 या 8 या 9 करके देखी. 90% ऑफ द जवाब होता था हमको जरूरत नहीं है, सुश्रुत और चरक सबने विद्वानों ने लिख दिया, यही हम कर रहे हैं. मैंने कहा अगर सुश्रुत और चरक अभी भी होते, वो नहीं करते ऐसे, वो साइंटिफिक तरीके से सोचते. वो कहते हैं 15 जड़ी बूटियों से जो फायदा हो रहा है वो शायद 1 से हो जाए. तो जनरल आयुर्वेद का सवाल है डॉक्टर साहब ऐसा नहीं है, वो 15 आपस में ना मैच करती हैं, वो उसको सबसाइड करती है, उसको ट्रीट करती है. मैंने कहा आप एक चीज दवाई दे रहे हो उसको कम करने के लिए, दूसरी दे रहे हो आप बढ़ाने के लिए, तो दो ही मत. तो अच्छे आयुर्वेद कहते हैं जी हम एक और दवाई देते हैं और उसके कॉन्स्टिट्यूशन बेस्ड. ये सोच इज वेयर आई गो. ये जो साइंस ऑफ लाइफ का प्रोजेक्ट है, आई गिव ये पर्टिकुलर डिजीज वाता कॉन्स्टिट्यूशन प्रीडोमिनेंट, उसको लिए क्या देना चाहिए. जैसे जामुन के सीड्स हैं, दे वेरी गुड फॉर डायबिटीज, बट दे एग्रेवेट एंड एग्जैजुरेट वाता. मेरे ख्याल में वो वाता के कॉन्स्टिट्यूशन वाले को नहीं देने चाहिए, इवन दो इट इज गुड फॉर डायबिटीज. एनीवेज मैं आप फिर बोलता रहूंगा, बट दैट्स आई थिंक गेव यू अ जिस्ट ऑफ व्हाट आई एम ट्राइंग टू से.
थैंक यू सर, दिस इज एक्सीलेंट. तो डॉक्टर राजन जी थोड़ा आप बताएं कि जब आप नाड़ी परीक्षा करते हैं तो आप क्या देखते हैं नाड़ी परीक्षा में. सर अनम्यूट कर दीजिए.
हाँ यस यस, मैं तो इतना नाड़ी में एक्सपर्ट नहीं हूँ. मैं दर्शन स्पर्शन प्रश्न, तो स्पर्शन में नाड़ी परीक्षा तो की जाती है, पर मैं इतना छोटा हूँ कि सिर्फ वात पित्त कफ मतलब पेशेंट की प्रकृति जान करके उसको दवाई देना, उतना ही मैं नाड़ी परीक्षण करता हूँ। कि जैसा बग्गा जी ने कहा, कितना डीप सोच अब तक मैंने मतलब किया नहीं, मतलब कि इन प्रैक्टिस नहीं करता हूँ, जो भी बेसिक है आयुर्वेद के हिसाब से वो करता हूँ। और पेशेंट को उसकी प्रकृति बताने के बाद कि जैसा कि बग्गा जी ने कहा कि उसके जो वाइब्रेशंस है और उसकी जो रेट है या उसकी जो गति है, वो हिसाब से भी अगर हम लोग पेशेंट को उसकी प्रकृति बोल देंगे या उसका स्वभाव, तो भी वो डायग्नोसिस के लिए और मेडिसिन के लिए बहुत अच्छा रहता है, ये मेरा मानना है।
थैंक यू सर। पवन जी, ओवर टू पवन जी। पवन जी, आप आगे लेके चलिए डिस्कशन को।
I would like to request now Stina from Sweden. Kindly unmute yourself, Stina. What is your opinion regarding today's discussions? How to become good, best Ayurvedic practitioner?
Hello, Namaskar. Nice to be here. It's such a wonderful webinar that you have here, and I'm very happy to be able to join you today. I feel Ayurveda is such a vast knowledge, and you're so it's fantastic to see how you can practice this in India. And I feel in Sweden, where I live, it's quite different. And sometimes people come to us who are Ayurvedic practitioners when they have given up on the allopathic medicine. And I feel that they rely so much on Ayurveda or alternative medicine, and in the same time, we don't have the education enough here. And also, I will say that we don't have that much, and Ayurveda is not that well recognized here, but we do have some practitioners. And well, my question is, I have many questions, but one of them is how to get enough practice in a country where we have no clinics to practice in. So how to do this in a way that we can learn Ayurveda and also have experience from other people? I feel this is very important. And when we have education in Sweden, we don't have that much education, so we usually go to India to get it. But then sometimes we need some more practice. So that's my question. How can we get that practice?
I can suggest one answer only. Free camps in colleges, free camps in old age homes, free camps in schools. If we can organize, you would have line of subjects for practice, because you have to practice it on number of patients. Then also you can gain experience, not by theory only, not by video classes only. This is very subjective case, individualistic, different from person to person, according to the Prakriti, Desh, Kal, so many factors are there. So I hope your answer is there. Now, Patankar Saab would like to say something.
In my opinion, public awareness, as said by Pawanji, is the key factor for your practice of Ayurveda in any other country than India, where that is not still validated or still not up to the people. So that's why public awareness, as looking through the camps in schools, in colleges, in old age homes, and in public also. So that will be more beneficial. And in my opinion, they must taught first of all the Rutucharya, that is daily regime, then seasonal regime, as per your country and that climatic conditions. That is, in my opinion, it's important to promote Ayurveda in any country except India. That's my opinion.
Thank you so much. Thank you so much. It's very good advice, and I think you are really all right, because we need to, people need to know more about Ayurveda, and I also feel making simple advice would be very efficient for people, and also I feel it's important to, sometimes is the easiest advice that will give the best result, and stop with one bad behavior and start with one good behavior. That is sometimes really good for people. Sometimes we put so much pressure on the clients, and they have difficulties making too much. And when I talk to Indian doctors who are practicing in Sweden, they can also see that in Sweden we really have to be careful not to give too much advice. And in India, they say, I don't know about you, but they say that in India, people will follow your advice if you give them. And that is not the case here. So for us, it might be a little slightly different practicing Ayurveda, and also know our limitation. It is so important. Know our limitations and where my knowledge ends, and when I can advise patients to go to a doctor, since I am not a doctor, then I feel this is very important, and also to cooperate and to I do have groups sometimes, and I feel that people strengthen each other while learning about Ayurveda and how to implement it in the daily life. I learn so much when I listen to you, and that's that I really think that more people should come here as well and joining. So thank you so much.
Because in my opinion, there are different laws and different criteria as per the different in different countries, so that you have to also follow those laws and criteria. So thank you.
Stina, I'm Dr. Harish Verma. I have advice for you. As Dr. Pavanji has suggested, you can do volunteering work in India. You can go to India, do some voluntary work. You can organize free camps in rural areas under guidance of some senior Vaidya like Dr. Rajanji and other Vaidyas. So you can learn a lot while in India how to implement Ayurvedic method of treatment. You can start some volunteering work in India by organizing free camps in various parts of India.
That sounds amazing. I will go there as soon as I can.
All right. Thank you.
Thank you.
You are always welcome.
Thank you. Thank you. I have another question. When you have clients or patients, do you ask them how they feel about the treatment, and do you do the follow-up, or how do this happen?
Yes, definitely. After giving 8 or 15 days of medicines, the patient comes for follow-up, and we match each and every aspect by seeing his nadi, then darshan and pariksha, and we correlate with the patient's input, how he is feeling, better, best, or okay. And then we, after correlating all these things, if it's needed, we change the medicine, because in Ayurveda, the medicines should be taken at the proper time. That is most important. Some patients, if we suggest them to take medicine before lunch or before dinner, and if they take the medicine after lunch or after dinner, the effect of the medicine is not there. So that's why administrating the medicine is also most important part as per Ayurveda. So we correlate both the things, and then we will give him numbers in plus or minus, and then we suggest any other supportive treatment like panchakarma or anything, or with only shaman chikitsa.
Okay, so this is I feel that we can suggest people to do things here, but they cannot always afford it since it's very expensive to go to panchakarma also, and not many people offers it that well. So I feel that it can be difficult to do the follow-up here, at least because they don't have to come back. It's their choice, and we do the best to inspire them to come back. And sometimes we just do it almost like for free, just because we need to keep a record and we need to learn how efficient it really is. But to always, does it happen that clients don't come back?
Very few clients are dropped out, but most of the clients, means I should say 95%, they came back and came back for follow-up in regular practice.
Okay, great. Thank you so much.
Thank you, Srinaji. Thank you, Rajanji. Now I would like to request the audience, if any comment on the focused topic, that how a doctor can become best practitioner.
Venkatji is there. Venkat Dharmadhikari.
I would like to welcome any comment from any expert from the audience. Ganesh ji, yes, Barma ji, please.
Ji. So in my opinion, Ayurvedic practitioners should learn modern diagnosis. This is very important, because if we don't know the modern diagnosis, then you can't even satisfy the patient, because nowadays patients come with a lot of knowledge from internet, from the previous doctors, and the reports they are carrying. They are interested that the doctors should be knowing everything about the reports they are carrying. And if you have no knowledge about the modern diagnosis, modern investigations, modern radiological investigations, you can't satisfy the patient. So in my opinion, all Ayurvedic doctors should have a full knowledge, thorough knowledge of modern diagnosis. Of course, they should understand the concept of Vata, Pitta and Kapha. They should know the difference between how to diagnose Anshansh Kalpana of doshas through in the Vikriti stage. And of course, they should have a full knowledge of application of proper Ayurvedic medicines, proper Ayurvedic techniques, particularly if they are recommending Shirodhara or if they are recommending Sanshodhan Chikitsa, Panchkarma. They should have a thorough knowledge, no doubt about it. But parallelly, they should have a full knowledge of modern terms, the modern diagnosis. We can take an example of COVID. Yes, sir.
Sir, in India, for AYUSH department, unemployment is there, as we all are aware of it. So 80% of Ayurvedic doctors, BMS doctors, are being absorbed in so-called 5-star multinational hospitals. They are RMOs there. So they know only allopathy. This is unfortunate for Ayurveda. They should know also Vata, Pitta, Kapha along with that.
Yes.
But they are happy because their per hour salary is there. Per hour. Rates are fixed according to the hospital and seniority of doctor. Hospital gets those doctors in half price and doctor gets employment because there is no employment in AYUSH. This is the fact, hard fact. I hope Patankar Sahib will agree with me and Agnihotri ji. 20% doctors are expert in Ayurveda because they have an aim, either aim or they have got the service of Ayurveda. If they have got the service, suppose in medical dispensary, suppose 360 or 380 essential drug list is announced by government for ideal Ayurvedic dispensary. Unfortunately, out of those 400 drugs, only 40 or 50 or 60 drugs are available. So the duty of that doctor particularly is to treat the patient within the available medicines, and he can prescribe 1 or 2 medicines from outside. That is a separate issue. But this is the real ground level Ayurveda. Patankar Sahib.
Correct.
Am I wrong, sir? Patankar Sahib?
Yes, 100% correct. So, regarding Harish Verma's question, कि yes, एलोपैथी का ये तो जानना जरूरी है, थरो नॉलेज रखना, पर जैसा अभी पवन कुमार जी ने कहा कि 90% डॉक्टर्स को एलोपैथी के सब डायग्नोस्टिक मेथड्स या उनके बाकी सब चीजें मालूम है, पर आयुर्वेद मालूम नहीं है. तो ये थोड़ा सा दुर्भाग्य है इंडिया के लिए. सो हरीश जी, आपका जो ये कमेंट है वो कैरी कीजिए. Carry on.
Ji. Yes, this is today we are discussing how to become best Ayurveda practitioner. So to become our best Ayurveda practitioner, we need to integrate modern science. And in today's discussion, I picked up 2 points, very important points. One from Dr. Jayesh ji. He emphasized on meditation part also, because if a Ayurvedic doctor can't touch the soul of a patient, then he will not be able to completely cure the disease. And the second part I picked up from Dr. Dr. Yerne, and she emphasized on that the Ayurvedic doctor should have his own pharmacy and his own small library. This is very important. So to become a good Ayurvedic practitioner, we should blend everything. We should have full knowledge of modern diagnosis, full knowledge of Ayurveda. Of course, Ayurveda knowledge is definitely required for the Ayurvedic doctor, how to diagnose the disease on the basis of Vata, Pitta, Kapha, Ansha, Kalpana, pulse diagnosis, Prashan, Prachnam, and Darshanam, everything. They should have a full knowledge, and on the top of it, they should have a full knowledge of pharmacy, how to develop their medicines, and for good knowledge, they should keep a small library in their clinic. This is how I conclude today's webinar. Thank you, sir.
पवन जी,
Agnihotri ji, Professor Agnihotri ji, if you are available online from the train, welcome. I salute your zeal. He is joining from train.
Yes.
Jagdishwar ji, respected Jagdishwar.
अग्निहोत्री जी है ना?
Agnihotri ji, welcome.
Hello. नहीं, ये सुनना
कनेक्ट करना पड़ेगा।
वो कहना नहीं, पर पहले सिग्नल तो मिले, अभी हेडक्वार्टर पे आएगा तो चलेगा। हेलो
ये मेरा ना हरदोई आ रहा है क्या? हरदोई आएगा। हाँ तो ठीक है। ये नहीं वेबिनार चल रही थी चलिए। मेरा इंटरेस्ट वेबिनार है तो मैं अभी लिख कर रहा था। I have to give my
अग्निहोत्री जी प्रणाम।
जी जी नमस्कार नमस्कार हेलो actually we are not getting signal proper so my sound might not be audible regular हेलो
हाँ जी।
हेलो अरे मेरी आवाज कट कट के आ रही होगी उनकी सिग्नल नहीं चल रहे ट्रेन मूवमेंट में है ना इधर इधर
आ रही है, आ रही है,
आ रही है अच्छा अच्छा धन्यवाद
आपकी आवाज को काट सके ये ट्रेन में हिम्मत नहीं।
नहीं अभी हरदोई के आसपास हम पहुंचे वाले तो हेडक्वार्टर पर सिग्नल अच्छे मिल जाएंगे मैंने शुरू में तो दोनों ही अपने रेस्पेक्टिव स्पीकर्स को सुना है और जगदीश ये अपने राजेंद्र पटेंकर जी ने तो बहुत ही बेसिक बातें बताई और अच्छा लगा लेकिन उन पर जो क्वेश्चंस आ रहे थे अपने डॉक्टर हरी शर्मा जी के वो बहुत इंपॉर्टेंट थे और बाद में उन्होंने उसको और बढ़िया से क्लैरिफाई किया मैं उनको मैंने उनके साथ हूँ उनके जयेश जी ने बहुत ही क्रिटिकल पॉइंट बताई और सारी समस्या हम लोगों के ऊपर है कि those in sense that whatever our treatment part is there so we have to use our treatment part along the diagnostic setups made by the persons. So, और मल्टी
आपकी आवाज कट रही है सर, आपका कनेक्शन कट गया। मैं आदरणीय जगदीश्वर जी हाँ अग्निहोत्री सर, if anybody would like to say anything, डॉक्टर जयेश ठक्कर जी।
नहीं आते आवाज तो आपने एम्प्लॉयमेंट की प्रॉब्लम वजह से नहीं मिल पाता है और अवेलेबल रिसोर्सेज है उनका प्रॉपर यूज तो थैंक्स फॉर आवर पर्सन वैल्यू जी जगदीश जी डिप्टी शर्मा साहब हरी शर्मा जी
थैंक यू सर, थैंक यू वेरी मच, सर। जगदीश्वर जी प्रणाम। जगदीश्वर जी, in your opinion, what should be the qualities of a Vaidya? Oh, sorry, practitioner. Vaidya Jagdishwar ji from Telangana. Respected Jagdishwar ji, am I audible to you? Yes, welcome. Welcome. Yes, welcome.
So there is no audibility. No audibility.
No, you are audible. You are audible.
For me, there is no audibility.
That is fault at your end, sir. Please bless us, please.
Hello. Dadaji,
Yes.
there is no audibility for me.
No problem, sir. We are
मुझे
listening
सुने
you.
नहीं आ रहा है.
Please बोलिए ना.
Some problem in connection from their side. I think so. दोमा जी की तरफ से.
Yes.
हाँ.
So, okay, sir. I hope there are no questions from the audience.
दादाजी सुने नहीं आ रहा है. मुझे
आप
तो सुने
बोलिए
नहीं
ना
आ रहा है
सर.
कुछ भी.
आप बोलिए. I hope we should end today's discussion. Thank you, and we are meeting day after tomorrow for Hanuman Jayanti. Again, one unique subject, Sanjeevani,
हेलो
mythology and
दादाजी, मुझे
efficacy.
कुछ भी सुने नहीं आ रहा है. आपका फिगर दिख रहा है उतना ही. मुझे कुछ भी सुने ना रहा है काफी देर से.
Okay, sir. Now we are ending, sir. Day after tomorrow on Hanuman Jayanti, Hanuman Janmotsav, we will be celebrating one speaker from Sri Lanka, Commissioner of Ayurveda, Dr. Dhammika, who will tell about Sanjeevani, Vati or Bhuti, whatever it may be, and from where Hanumanji took that Sanjeevani. So from Uttarakhand, two speakers will be there, Dr. Deepchand Pandey, Dr. Vinod Upadhyay, and Dr. Naveen Joshi of Ayush Darpan. He will also be there. So please do join. Please join on day after tomorrow. And if you have any expert with reference to hemophilia, who is working on hemophilia, who has successfully treated the cases of hemophilia, please recommend. We will invite him on World Hemophilia Day. Thank you, sir. Well, good night. Good night to all. Good night.